and improve the process. We look for a healthcare outcome that is really challenging for us. The mortality, morbidities, quality of life, there's so many, especially India concerns. We are very much, we are diverse in the populations. We are fourth in globally, but the poorest to poor in India. Think about this, all the concerns. How we are trying to overcome the challenges. I think today nursing students who are maybe, I think I am the first men in nursing in Tamil Nadu, and especially we can say India in 92 batch. I can see our student today, the strength is very high, they are very intellectually good, but lot of scope for them to improve. The nursing itself, they are going to be, that professions, how they are going to be career very different, not like us, like we can become only nurse clinician that time, or maybe educator. There is a lot of scope for them, especially who are studying at like PhD or very reputed institutions. So I wish you all the best for this organizing the conference. I always talk a lot. Thank you very much. We'll be coming back to my session. That time we'll discuss a lot. Thank you very much.
Thank you, sir. Thank you to all our respected dignitaries for their gracious and meaningful felicitation addresses. Your words of appreciation have truly added value and dignity to this inaugural session and have set an inspiring tone for this conference. On behalf of the organizing committee, I express our sincere gratitude to each of the speakers for sparing their time and for sharing their thoughtful insights and warm felicitation.
We are privileged to have Dr. Vikram Kumar, who is an award-winning Siddha physician and prolific health educator with 12 years of distinguished government service, renowned for his exceptional contributions to traditional medicine, public health education and community. Serving as Assistant Professor, Assistant Medical Officer, Siddha at Government Primary Health Center, Andiyappanur, Tirupattur District since December 2013. His outstanding service has earned him prestigious recognition at the highest levels, including the Best Doctor Award and medal from the Honorable Chief Minister of Tamil Nadu on the 75th Independence Day in the year 2021, followed by a second cash award from the Chief Minister in November 2021. His pioneering work during the COVID-19 pandemic earned him the Vikadam Top 10 Youngster Award for 2020 for his significant contributions to COVID Siddha treatment protocols. Sir, may I request you for the Chief Guest Address.
Happy morning to one and all present over here. It's my pleasure to deliver this address in front of you all people and the distinguished delegates. I would like to take this session bilingually. Okay va? தமிழ்லையும் பேசலாம்னு நினைக்கிறேன். ஓகே, தேங்க்யூ. ஏன்னா சில உணர்வுபூர்வமான விஷயங்களை கடத்துவதற்கு நம்முடைய தாய்மொழியை விட சிறந்த ஆயுதம் எதுவும் இல்லைன்னு நான் நினைக்கிறேன். ரைட்? ஸோ ஐ வுட் ஆல்சோ ஸ்பீக் இன் தமிழ் அண்ட் இங்கிலீஷ் since many people couldn't understand Tamil. Okay, I have to thank the PSG management and Dr. Jaydeepa ma'am, the principal, and Dr. Subhashini ma'am, Dr. Jennifer ma'am, since she has been coordinating with me for the last 1 month or so. உள்ள நுழைஞ்ச உடனே ஒரு டாக்டர் கோபிச்சந்திரன் சார் ஸ்பீக்கிங் இன் அ பாசிட்டிவ் வைப். அவர் சொன்னார், கோயிலுக்குள்ளே போகும்போது எனக்கு அடிக்கடி பாசிட்டிவ் வைப் வரும் அப்படின்னு சொல்லியிருந்தாங்க. எனக்கு என்ன தோணுதுன்னா, உங்களெல்லாம் பார்க்கும் பொழுது, இங்கே இருக்கக்கூடிய பெரிய மனிதர்களை எல்லாம் பார்க்கும் பொழுது ஒரு பாசிட்டிவ் வைபர் தான் எனக்கு தோணுது. ஃபேக்ட்னு சொல்லலாம். ஏன்னா டாக்டர் அனிதா மேம் உள்ளே வந்த உடனே ஷீ செட் ஹாய். அந்த ஹாய்லேயே அவ்வளோ ஒரு உணர்வுபூர்வமான ஒரு நட்பு இருந்தது. ஏன்னா இப்போ இருக்கக்கூடிய சூழலில் ஒருத்தருக்கு ஒருத்தர் யாருமே பேசிக்கிறது இல்லை இல்லையா? ஸோ அதற்கான தொடக்கமாக ஹவு டு கம்யூனிகேட் அப்படின்ற ஒரு விஷயத்துலேருந்து நம்ம இந்த கான்ஃபரன்ஸ் இன்டெகிரேட்டிவ் தீம்குள்ளே எப்படி போகலாம் அப்படின்றத பற்றி பேசுவோம். உலகம் தேடிக்கொண்டிருக்கக்கூடிய விஷயமே என்ன அப்படின்னா, பேஷண்ட் சென்ட்ரிக்கா ஹவு வி குட் இம்ப்ரூவ் இஸ் ஹெல்த். ஹோல் வேர்ல்டு இஸ் இன் சர்ச் ஃபார் தட் தான் அப்படின்னு சொல்லலாம். ஸோ இங்கே பிஎஸ்ஜி மேனேஜ்மெண்ட் வைத்திருக்கக்கூடிய தீமே அவ்வளோ அழகானது. இன்னோவேட்டிவ், ஹோலிஸ்டிக் அண்ட் இன்டெகிரேட்டிவ். ஸோ இன்னோவேட்டிவ் இன் த சென்ஸ், எந்த ஒரு துறை, வாட் எவர் ஃபீல்ட் இட் மே பி, வி நீட் ஒரு யூனிக்னஸ் இருக்கணும். வி நீட் தட் ஸ்பெஷல் திங்னு சொல்லலாம். ஒரு புதுமை இருக்க தான் அந்த துறை அடுத்த கட்டத்துக்கு நகரும்னு சொல்லலாம். ஆனால் நம்ம மருத்துவத்துறை நகர்றதுக்கு எந்த விஷயமும் இல்லை. பட் பேஷண்ட் சென்ட்ரிக்காக எந்த வகையில் புதுமையை புகுத்தி நோயாளிக்கு நம்ம பல வகையில் நன்மைகளை செய்யலாம் அப்படின்ற ஆஸ்பெக்ட் தான் இன்னோவேஷன். நெக்ஸ்ட் ஹோலிஸ்டிக் அப்படின்றது எய்தர் ஆல் த சிஸ்டம்ஸ் ஆர் கெட்டிங் இன்டெகிரேட்டட் அப்படியும் வச்சுக்கலாம், இல்லை ஒரு சிஸ்டமில் இருக்கக்கூடிய ஹோலிஸ்டிக் அப்ரோச்சை பேஷண்ட் நோக்கி எப்படி நம்ம கொண்டு போகலாம் அப்படின்றதுக்கான மையமாகவும் இந்த ஹோலிஸ்டிக் அப்படின்ற டாப்பிக்கை we can take. அடுத்து இன்டகிரேஷன். இப்போ டாக்டர் கோபிச்சந்திரன் சார் வாஸ் ஆல்சோ ஸ்பீக்கிங் அபவுட் தட் இன்டகிரேஷன், ஹவு இட் இஸ் கெட்டிங் த வேர்ல்ட் டு சேஞ்ச். பேஷண்ட் சென்டருக்காக எப்படி இன்டகிரேஷன் எவ்வளவு முக்கியம் அப்படின்றத வந்து அழகாக பேசிகிட்டு இருந்தாங்க காலையில் வரும்போது. ஸோ மொத்தத்தில் இந்த உலகம் தேடக்கூடிய 3 விஷயங்கள், ஹோலிஸ்டிக் அப்ரோச், அந்த யூனிக்னஸ் தட் இஸ் இன்னோவேஷன் அண்ட் இன்டகிரேஷன் அப்படின்ற தீமை அழகாக கொண்டு வந்ததற்காக இந்த பிஎஸ்ஜி மேனேஜ்மெண்ட்டுக்கும் பிரின்சிபலுக்கும் ஆல் தி ஸ்டாஃப்ஸ் அண்ட் ஃபேக்கல்டிஸ் ஆர் இன்வால்வ் இன் திஸ் கான்ஃபரன்ஸ்க்கு ஐ ஷுட் தேங்க். ஏன் நம்ம இந்த இன்டகிரேஷன் பண்ணணும், ஏன் இந்த மாதிரியான கான்ஃபரன்ஸ் உலகம் ஃபுல்லாக நடக்குது, நம்ம குறிப்பாக நம்முடைய இந்தியாலையும் சரி தமிழகத்திலையும் ஏன் இந்த அளவுக்கு பெரிய அளவில் நடக்குது அப்படின்னு பார்த்தா, மிகப்பெரிய இக்கட்டான சூழலில் இருக்கும். நம்ம வேறு என்ன ஸ்டேட் ஆஃப் எமர்ஜென்சி ரிகார்டிங் ஹெல்த்னு சொல்லலாம். நடா கோவிட்லாம் முடிஞ்சிருச்சு, திரும்பி என்ன எமர்ஜென்சி அப்படின்னு நீங்கள் யோசிக்கலாம். என்ன அப்படின்னா, பாஸ்ட் செஞ்சுரியில் ஃபஸ்ட்டு ஸ்பீக்கிங் அபவுட் தி கம்யூனிகபிள் டிசீஸ், தொற்று நோய்களை பற்றி பேசி கொண்டிருந்தோம். அதற்கு சார்ந்து நிறைய ஆய்வுகளையும் பல்வேறு விஷயங்களும் செஞ்சு அதுலேருந்து வெளியே வந்துட்டோம். திரும்பியும் ஸ்டார்ட் ஆஃப் தி 21st செஞ்சுரியில் தொற்றா நோய்களை பற்றி பேச ஆரம்பித்தோம். கொஞ்சம் கொஞ்சமாக தீவிரம் அடைஞ்சிட்டு வந்தது. திடீர்னு திரும்பியும் அந்த கம்யூனிகபிள் டிசீஸ் கோவிட் வந்து கிட்டத்தட்ட 4 to 5 years நம்மளை அப்படியே நிலைநிறுத்த செஞ்சிச்சுன்னு சொல்லலாம். பட் அதை விட இப்போ திரும்பவும் இந்த நான் கம்யூனிகபிள் டிசீஸுடைய தாக்கம் அதிகரிச்சிட்டு இருக்கு அப்படின்றது நம்ம யோசிக்க வேண்டிய விஷயம். அதில் இப்போது அட் த மூமெண்ட் அல்லது நீட் ஆஃப் தி ஹார்னு சொல்லலாம். என்ன அப்படின்னா, வி ஆர் ப்ரோன் டு ஜெனட்டிக்கலி மாடிஃபைட் டிசீசஸ்ன்ற லெவலுக்கு வந்துட்டோம். தொற்று நோயிலேருந்து தொற்றா நோய்க்கு வந்து இப்போ ஜெனட்டிக்கலி ப்ரோன் டிசீஸ் அளவுக்கு ஆயிடுச்சு. காரணம் என்ன அப்படின்னா, நம்முடைய தவறான வாழ்வியல் ப்ளஸ் உணவியல் முறை, இதுதான் எல்லாத்திற்குமான நமக்கு நோய் ஏற்படுவதற்கான அடிப்படைன்னு சொல்லலாம். ஸோ தொற்று நோயிலேருந்து ஜெனட்டிக்கலி மாடிஃபைட் டிசீஸ் வரைக்கும் நம்ம வந்திருக்கோன்னா, இப்போவும் நம்ம கொஞ்சம் ஸ்டெபிளைஸ் ஆகிட்டு திருந்தலை அப்படின்னா we are going to end in troubleன்னு சொல்லலாம். என்னென்னா, ஒரு மனித இனத்தினுடைய அமைப்பே வந்து ஹெல்த்தியர் ஜீன்ஸை வி ஷுட் அடுத்த ஜென்ரேஷனுக்கு நம்ம கடத்தணும் இல்லையா? ஆனால் இப்போ அதுலேயே சிக்கல் ஏற்பட்டிருக்கு. இப்போ இருக்கக்கூடிய ஜென்ரேஷன், குறிப்பாக நீங்கள் உங்களுடைய வாழ்வியலையும் உணவியலையும் அழகாக அமைத்து கொள்ளவில்லை என்றால் உங்களுடைய மரபணுவில் பிழை ஏற்படலாம் அப்படின்னு சொல்லி மிகப்பெரிய அளவில் ஆய்வு ஏற்பட்டுருக்கு. இது அடுத்த தலைமுறைக்கு அல்லது அதற்கும் அடுத்த தலைமுறைக்கு கடத்தப்படும் பொழுது நினச்சி பாருங்கள், ஹோல் இந்த சொசைட்டியே ஏதாவது ஒரு ஜீனில் ஜெனட்டிக்காக பிழை இருக்குது அப்படின்னா என்ன சூழல் ஏற்படும் அப்படின்ட்டு. ஸோ நலம் அப்படின்ற தொடக்க புள்ளியிலிருந்து விலகி தொலைதூரம் நம்ம பயணிச்சிட்டோம். அதுதான் சிக்கல். திரும்பி அதாவது மங்கி ஆஃப் தி பேக் அப்படின்னு ஒரு ஃப்ரேஸ் சொல்லுவாங்க ஆங்கிலத்தில். அந்த மங்கியை தூக்கி போட்டுட்டு திரும்பியும் நம்ம அந்த நலம் அப்படின்ற மையத்துக்கு வரலை அப்படின்னா இந்த மாதிரியான நிறைய கான்ஃபரன்ஸ் நடக்கணும், நிறைய விஷயங்கள் தொடர்ந்து நடந்துட்டு இருக்க அளவுக்கு போயிடக்கூடாது. ஸோ நீங்கள் ஸ்டூடெண்ட்ஸ் ஆகவும் சரி, இங்கே இருக்கக்கூடிய ஃபேக்கல்ட்டிஸ் ஆகவும் சரி, மருத்துவர்களாகவும் சரி, மக்களுக்கு நாம் என்ன செய்ய வேண்டும், எந்த வகையில் இந்த மாதிரியான நோய்கள் ஏற்படாமல் தடுக்கலாம், உணவியலில் எந்த விதமான மாற்றங்களை கொண்டு வரலாம், லைஃப் ஸ்டைல் ப்ராக்டிஸில் எப்படி யோகா மூலமாகவோ ஆயுஷ் சிஸ்டம் மூலமாகவோ இல்லை இன்டெகிரேட்டட் அப்ரோச் மூலமாக எப்படி மாற்றங்களை கொண்டு வரலாம். ஸோ ப்ரிவென்ஷன் அப்படின்ற தீம் நோக்கி நம்ம பயணிக்க வேண்டிய சூழலில் இருக்கும். இன்னும் இந்த மாதிரியான நோய்கள் ஏற்படுறதுக்கான காரணம் எப்படி சொல்லலாம் அப்படின்னா, பாரம்பரியத்தை மறந்துட்டோம், மரபை தொலைச்சிட்டோம், சிறுதானியங்களை வெறுத்து ஒதுக்கிவிட்டு பெருந்தானியங்களுக்கு பெயிண்ட் அடித்து பாலிஷ் செஞ்சுட்டோம். நம் நாட்டு குளிர்பானங்கள், அதாவது நொதிக்க வைக்கப்பட்ட ஃபர்மெண்டட் ட்ரிங்க்ஸ் விச் இம்ப்ரூவ்ஸ் கட் பயோமை துரத்திட்டு பன்னாட்டு குளிர்பானங்களுக்கு சிவப்பு கம்பளம் விரித்து வரவேற்பு கொடுத்துட்டோம். உணவில் கலப்படம், தண்ணீரில் குழப்படம். இன்னொரு பக்கம் அறிவியலை புறந்தள்ளக்கூடிய எண்ணமும் தவறு தான். ஸோ அறிவியலும் தேவை, நம்முடைய ட்ரெடிஷனும் தேவை. இதில் ட்ரெடிஷ்னலில் இருக்கக்கூடிய மெய்ஞானத்தையும் அறிவியலையும் எடுத்து செல்லக்கூடிய பாதையை நம்ம கரெக்டாக கொண்டு போகணும். ஸோ இந்த மாதிரியான விஷயங்களை தொலைத்ததுனால இவ்வளவு சிக்கல். இன்னொன்று, சென்ற தலைமுறையுடைய உணவியலையும் இப்போது இருக்கக்கூடிய உணவியலையும் ஒப்பிட்டு பேசினாலும் நமக்கு என்னென்ன நோய் ஏற்படுதுன்னு சொல்லலாம். அதுக்கு சின்ன ஒரு பாடல் சொல்கிறேன். சங்க இலக்கியங்களில் நிறைய பாடல்கள் இருக்குது. நம்முடைய உணவியலை பற்றி நீங்கள் தெரிஞ்சுக்கணும் அப்படின்னா நம்முடைய லிட்ரேச்சர் யூ கேன் சர்ச் ஃபார் தட். அதில் சிறுதானியங்களை பற்றி ஒரு அழகான பாடல் இருக்குது. அதை அப்படியே சொல்லிட்டு இப்போது இருக்கக்கூடிய தலைமுறையினுடைய உணவியல் எப்படி இருக்குது அப்படின்ட்டு நான் சொல்கிறேன். ஏன்னா, வரகரிசி சோறும் வழுதுணங்காய் வாட்டும் முறமுறவெனவே புளித்த மோரும். ரைட்? வரகரிசி சோறும் வழுதுணங்காய் வாட்டும் முறமுறவெனவே புளித்த மோரும் அன்று. ஆனால் இன்றைக்கு வரவர பீஸாவும் வழுவழு சீஸும் முழுவெனவே புளித்து போன மயோனிஸ் சாஸும் இன்று. இதான் ஒரு பானை சோற்றுக்கு ஒரு சோறு பதம் அப்படின்ற மாதிரி நம்ம செய்யக்கூடிய தவறுக்கான சிறந்த எடுத்துக்காட்டுது. இது சிம்பிளாக இருக்கலாம். பட் வரகரிசி சோறில் இருக்கக்கூடிய அந்த மைக்ரோ நியூட்ரியன்ஸை பற்றி நினச்சி பாருங்கள். அந்த கத்திரிக்காய் தொடுகைக்கு இருக்கக்கூடிய ஃபைபர் கண்டென்ட்டும் சரி, அது கொடுக்கக்கூடிய ஊட்டச்சத்து பற்றி நினச்சி பாருங்கள். அடுத்து புளித்த மோர், we can take it as a probiotic மோர். ரைட்டா? கட் பயோம் பற்றி தான் உலகமே பேசிகிட்டு இருக்கு. ஐ வில் ஸ்பீக் அபவுட் த கட் பயோம் இன் மை செஷன் கம்மிங் அப் ஃபார்வர்ட். ஸோ அந்த கட் பயோம் இம்ப்ரூவ் பண்ணக்கூடிய மோரினுடைய இதை விட்டுட்டு நம்ம இந்த பக்கம் பார்த்தீங்கன்னா வர பீஸா என்ன இருக்குது இதில்? ஜஸ்ட் எம்டி கலோரிஸ். நம்மளுடைய ஒபிசிட்டிக்கான அடிப்படையாக இருக்க போக ஒரு விஷயம். அதே மாதிரி சீஸ் பற்றி நமக்கு எல்லாருமே தெரியும், டிரான்ஸ்ஃபேட். அடுத்து புளித்து போன மயோனி சாஸ். இப்போ நிறைய இடத்துல அது பேன் பண்ணிட்டாங்க, பட் ஸ்டில் இட்ஸ் ஆன்னு சொல்லலாம். இப்போது எனக்கு எப்போ மயோனி சாஸ் அப்படின்ற விஷயம் தெரியும்னா, நான் காலேஜ் படிக்கும்போது கிட்டத்தட்ட 15 வருஷத்துக்கு முன்னாடி அல்லது 20 வருஷத்துக்கு முன்னாடி மயோனி சாஸ் பற்றி எனக்கு தெரியும். என்னுடைய பேரண்ட்ஸுக்கு கிட்டத்தட்ட 60 இயர்ஸில் தான் மயோனி சாஸ்ன்னு தெரியும். ஆனால் என்னுடைய குழந்தைகளுக்கு இப்போது 4th ஸ்டாண்டர்டும் 2nd ஸ்டாண்டர்டும் தெரியுறாங்க. ஒரு ஹோட்டலுக்கு போனால் உங்களுக்கு அந்த மயோனி சாஸ் அறிமுகமாயிடுது. ஸோ யாருக்கு பெரிய பாதிப்பு அப்படின்னு நினச்சி பாருங்கள், எனக்கா, என்னுடைய பெற்றோருக்கா, அல்லது அடுத்த தலைமுறையாகிய உங்களுக்கா? ஸோ நம்ம வி ஷுட் டேக் கேர் ஆஃப் ஆல் திஸ் நுவான்சஸ். நிறைய விஷயங்கள் நம்ம தவறு செஞ்சிட்ருக்கோம், நம்ம இன்னும் நடக்காது, நடந்த பிறகு பார்த்து கொள்ளலாம் அப்படின்னு இருக்கக்கூடிய எண்ணத்தை நாம் நிச்சயமாக மாற்ற வேண்டிய சூழலில் இருக்கோம். பீயிங் ஹெல்த் ப்ரொஃபஷனல்ஸ், பிஃபோர் டெல்லிங் டு தி சொசைட்டி, வி ஷுட் பி வெரி வெரி கேர்ஃபுல் இன் ரிகார்டிங் தி ஃபுட் அண்ட் தி லைஃப் ஸ்டைல் தட் வி ஆர் கோயிங் டு ஃபாலோ. இந்த விஷயத்தில் நம்ம கரெக்டாக இருந்துட்டோம் அப்படின்னா எதிர்காலத்தில் சொசைட்டியை மாற்றக்கூடிய விஷயமா இருக்கலாம். அடிக்கடி சொல்லுவாங்க, இன்றைய இளைஞர்கள் நாளைய தூண்கள் அப்படின்லாம். அதெல்லாம் கடந்து இப்போது இருக்கக்கூடிய ஹெல்த் ப்ரொஃபஷனல்ஸ் தான் அடுத்த கட்டத்தில் மனிதர்களுடைய வாழ்க்கையை மாற்றக்கூடிய சூழலில் எல்லாருமே நின்றுட்டுருக்கோம் அப்படின்றத நான் உறுதியாக சொல்கிறேன். ஸோ திரும்பி சொல்கிறது என்னென்னா, ஃபஸ்ட் டேக் கேர் ஆஃப் யுவர் ஹெல்த். நீங்கள் கரெக்டாக இருக்கணும். அதில் எந்த வகையாக இருந்தாலும் சரி, ஃபிசிக்கலாகவும் சரி, மென்டலாகவும் சரி, வி ஷுட் பி வெரி வெரி ஸ்டேபிள். ஏன்னா இப்போ என்சிடிஸ் பற்றி பேசணும்னா டயபெட்டிஸ் ஆகட்டும், ஹைப்பர் டென்ஷன் ஆகட்டும், இன்ஃபர்டிலிட்டி ஆகட்டும், ப்ரிகாஷியஸ் பிபர்ட்டி ஆகட்டும், இன்னும் கேன்சர்ஸ் ஆகட்டும், மனநோய்கள் ஆகட்டும், எவ்ரி திங் இஸ் ஆன் அ ரைஸ்ன்னு சொல்லலாம். டயபெட்டிஸ் பற்றி பேசணும்னா வி ஹேவ் பிகம் தி டயபெட்டிக் கேபிட்டல், ரைட்? அதில் இப்போ என்னென்னா குழந்தைகளுக்கு, அதாவது ஸ்கூல் கோயிங் சில்ட்ரனுக்கு டைப் 2 டயபெட்டிஸ் வந்துட்டுருக்கு. ஸோ வி ஷுட் டேக் அ நோட் ஆன். முன்னெல்லாம் ஒரு ரேஷன் கார்டு மாதிரி இருந்த டயபெட்டிஸ் ஒரு 10 இயர்ஸ் முன்னாடி வந்து குடும்பத்தில் ஒருத்தருக்கு அப்படின்ற அளவுக்கு அதுவே தவறு தான் அப்படி வந்தது. இப்போ என்னென்னா இட் இஸ் பிகமிங் லைக் அன் ஆதார் கார்டு டயபெட்டிஸ். என்னென்னா எய்தர் டயபெட்டிக்காக இருக்காங்க, இல்லைனா தே ஆர் இன் அ ஸ்டேட் ஆஃப் ப்ரீ டயபெட்டிக். ஸோ இதெல்லாம் மாறியே ஆகணும். அதே போல் ஹைப்பர் டென்ஷனும், ஸ்கூல் கோயிங் சில்ட்ரனுக்கு ஹைப்பர் டென்ஷன் பற்றி பேசுகிறாங்க. அடுத்து மனநோய்கள். முன்னெல்லாம் 10,000 ஒருத்தருக்கு ஒரு மனநோய் இருந்தது. அடுத்து 1000 ஒருத்தருக்கு மனநோய் வந்தது. இப்போது 100 ஒருத்தருக்கு a person is having some disturbance. மனநோய்னா நீங்கள் தனுஷ் படத்தில் 3 படத்தில் வர மாதிரி பைப்போலர் டிசார்டரோ, இல்லை ஜோதிகாவுக்கு சந்திரமுகியில் வர மாதிரி ஸ்பிளிட் பர்சனாலிட்டி டிசார்டரோ இருக்கணும்னு அவசியம் கிடையாது. நம்மளுடைய அன்றாட செயல்பாடுகளை உற்சாகமாக செய்யாமல் ஏற்படக்கூடிய தடையும் ஒரு வகையான மனச்சோர்வு தான். நிறைய பேருக்கு அந்த சிக்கல் இருக்கும், ரைட்டா? டியூ டு லாட்ஸ் ஆஃப் டிஸ்டர்பன்சஸ். நம்ம சோஷியல் மீடியாலையும் சரி, நம்முடைய திங்கிங்னாலையும் சரி, அந்த ப்ராசஸ் மாறிட்டே இருக்குது. ஸோ வி ஷுட் மேக் அ சேஞ்ச். we are in a stage to make change to ourselves and to the society. இந்த சூழல்ல இப்படியான ஒரு கான்ஃபரன்ஸ் அப்படின்றது இட்ஸ் a great boon நான் சொல்லுவேன். being a சித்தா practitioner, இன்டகிரேஷன் அப்படின்றது மிகப்பெரிய வரம். ஏன்னா நிறைய ரிசர்ச் ஆஸ்பெக்டில் எக்ஸ்ப்ளோர் பண்ணுறதுக்கும் சரி, சித்தாவில் இருக்கக்கூடிய ஆழமான விஷயங்களை மக்களுக்கு, பொதுவாக சித்தா அப்படின்னாவே வெறும் பார்வையே வேற மாதிரி இருக்கும். பட் ஆனால் அதுக்குள்ளே இருக்கக்கூடிய ஆழம் மிக மிக பெரியது. இட் ஹேஸ் சயின்ஸ் பிஹைண்ட் இட். ஸோ அதை எக்ஸ்ப்ளோர் பண்ணுறதுக்கும் சரி, மற்ற சிஸ்டங்களில் இருக்கக்கூடிய விஷயத்தையும் இன்டகிரேட் பண்ணுறதுக்கும் சரி, மொத்தமாக மாடர்ன் மெடிசனோட சேர்ந்து ஹவு வி கேன் ஹெல்ப் தி பேஷண்ட்ஸ் அப்படின்ற கட்டமைப்புக்கு நம்ம நோக்கி வந்திருக்கோம் அப்படின்றதுல எனக்கு மிக்க மகிழ்ச்சி. ஸோ ஒன்ஸ் அகைன் I thank the management of PSG, the principal, the whole staffs involving, and the enthusiastic students who are listening to this seminar. It will be a great session upcoming forward. I am also very, very eager to learn from all the delegates who are going to present their topic. Thank you. Thank you so much.
Thank you, sir, for the significant information delivered. நமது தாய்மொழியாம் தமிழ் மொழியில் நமது மரபு சார்ந்த தங்களின் அழகான விழிப்புணர்வு நிறைந்த அறிவுறுத்தலுக்கு நன்றி ஐயா.
Honored to release the college souvenir, this collection embodies the spirit of collaboration and innovation in holistic health. Gratitude to all the contributors and participants. Let's advance the integrative health together. May I request the chief guest of the day, Dr. Vikram Kumar, to release the conference souvenir. I request Mrs. Kartiki Deepa, Mrs. Keerthana, Mrs. Vikashni, Mrs. Jennifer Gracie, souvenir committee to help in releasing the same.
Thank you, dignitaries. The sessions are about to begin. There are few announcements. Keep your mobile phones in silent mode. Maintain silence throughout the session. Participants for poster presentation are requested to hand over the posters to the registration desk. The future of medicine lies in understanding that healing the part requires honoring the whole. It is our privilege to have with us Dr. R. Jayadeepa, Principal, PSG College of Nursing. After her bachelorate in nursing, she has completed PGDHM, PG in nursing, MBA in hospital administration, doctorate in nursing, and currently pursuing Indo-American Fellowship in evidence-based practice and PDF in nursing research. She has done NPTEL courses, many certificate courses related to forensic nursing. After completing PG, she has worked in Ashwini College of Nursing, Karuna College of Nursing, IQ City Institute of Nursing Sciences in various academic positions from assistant professor to principal. At present, she guides 3 PhD scholars at Sri Balaji Vidyapeeth Deemed University, Puducherry, also at Lincoln University, Malaysia, and the West Bengal University of Health Sciences, Kolkata. She is the recipient of Best Principal Award by Research India Foundation on 26/1/25. She has authored a textbook on critical care nursing by CCN Publications and written chapters in 4 books. She has innumerous publications to her credit. She has been a resource person, moderator, panelist in various symposiums, seminars, and conferences. Her wide range of accomplishment explain the passion towards her career. I now invite our Vice Principal Ma'am, Professor Meera Saravanan, to welcome our Principal with a nut basket. Thank you, ma'ams. I now request ma'am to take over the session.
So once again, a very good morning to one and all gathered here. Actually, this is for the delegates from outside for your information. PSG College of Nursing is having a student exchange program with Switzerland, La Source and Hesab University since 2011. Every year the students come here during winter and we send our students during the summer. So this is how the knowledge, cultural exchange between these two countries are happening for a long time. Since 2011 we are continuing this. We are so proud to say this. So as part of the student exchange program, this year we thought we will host one international conference. Every year along with the Switzerland students, Indian students, some of them will participate. It is difficult to host all the students together. So I thought we will give this experience to all our students to have an idea of to be with the foreign students and to have some exchange. So that is how the conference idea has come, and we wanted to give a different experience to the students from Switzerland also. I hope you enjoy this conference. Because if we organize a conference like this, we can bring many experts so that students will get a better knowledge. So with this idea and hope only this conference is planned, and I am going to take just an introductory session of what we are going to see the whole day. You will be learning lots and lots about holistic health. This is just a introduction of what holistic health is. So I will be speaking on science of holistic health, evidence, evolution, and future direction. So once again, greetings from PSG College of Nursing, one of the premier institutions of nursing education in India. My presentation is very simple. I'm not going to talk much. I will just tell you the concept of holistic health, evidence of it, evolution, how the holistic health concepts are evolved, evidence, and what is the future. So this is very simple. There are experts who will be talking or adding details to this presentation. Just to start with, health is a state of body, wellness is a state of being. Many of us don't understand the difference between health and wellness. Many times we say, I'm not well. feeling sick, so ill, not comfortable, discomfort. Every word has a different meaning. And welcome Subhashini ma'am. Every word has a different meaning, and we have this feeling in a 24 hours day. Many times it fluctuates. It's not constant. It is not same all the day, all the time. When we are with some people whom we like, feeling comfortable. If somebody we don't like, we are not comfortable. We can't define what makes us to feel well and what makes us not to feel comfortable. So this differentiation we must understand. So health is a state of a body, wellness is a state of being. To introduce health in 21st century is shaped by complex interaction between biological vulnerability, psychosocial stressors, environmental exposures, cultural practices and health systems. Health is very complex. It is very difficult to define. Though we have lots of definitions, but still there are many components missing, because definition of every individual's health is different. Only I know what is health for me. Only you know what is health for you. So this complexity is increasing day by day. Health is a dynamic state of complete physical, mental, social and spiritual well-being. The only one definition which everybody knows thoroughly without seeing a book is definition of health by WHO. Are you all agree with me? As if I ask definition of nursing, many nursing students will find it very difficult to say. But the definition of health, the very first definition what we learn when we enter into a healthcare professional course is this, and this stays like how we remember the nursery rhymes, we remember this till the end. So that much it is deeply rooted into our blood. So this is the definition of health. But what is well-being? Well-being refers to a positive state in which individuals realize their abilities, cope effectively with life stressors, work productively, maintain fulfilling relationships and experience a sense of purpose, balance and quality. A very complex definition. Definition of health is very easy. Definition of well-being is very difficult. But from you get up till you go to bed, if you are able to fulfill all activities, what are you supposed to perform with full abilities, full capacities, without any discomfort, you love the work, enjoy the work, then you feel comfortable. So this is well-being. So you are sitting comfortably, you don't have no aches, no pain, no discomfort. I understand many of you traveled whole night. I'm sure you will feel sleepy today, and I have seen some of you are sleeping in the morning only. But remember that this day you will get only now. Live this moment, enjoy this moment, learn this moment. This conference will not happen on next day. So be active, mind is everything. If you say your brain that I should be awake, I should listen to, so you fine tune yourself to this. I just wanted to say something about concepts of holistic health. Before we go to concepts of holistic health, we know the concepts of health. First concept is biomedical concept. What it says, absence of disease or infirmity. If you don't have any disease, you are healthy. This is what the biomedical concept says. It focuses on diagnosis, treatment and cure. And the biological factors are emphasized here, like pathology, lab values, your other components. So this functioning ability of your organs, this is what determine the health. So the limitations here is it ignores the psychological, social and cultural dimensions. You take blood test for me, everything is normal, but I am tired, not able to fulfill my work. So there is a limitation in this. Ecological concepts, this man is always interacting with the environment. There is a interaction between internal and external environment. When this interaction is balanced, you are healthy. If there is any disturbance in that, that causes disease. That is what ecological concept says. Psychosocial concept says health includes your psychological and social well-being. So that is also important to maintain health. What is positive health concept? That is the ability to realize aspirations, satisfy needs and cope with the environment. Everybody has some objectives, goals, something to achieve. If you are able to achieve that, then you are health. That is what positive health concept says. There are many concepts: wellness concept, socio-cultural concept, spiritual concept, functional concept, preventive and promotive concepts. N number of concepts on health are there. We always say body, mind, spirit. We know what is body. Mind to some extent we know. I know 90% of many of us don't know what is spirit, where it is, how to find it, how to keep it. healthy. So there are many concepts evolving. One of the concept is holistic concept. It is an eclectic concept which integrates the philosophies and principles of all concepts together, that is holistic. So health is a state of complete physical, mental, social, spiritual and emotional well-being. This views individual as a whole, not as separate parts. Heart 1%, lungs 1%, stomach 1%. It is not like that because all are in one individual. This is what is understood in a holistic concept, and nursing philosophy is always integrative. From the very first, the nursing process teaches holistic approach only. So why we have to talk about holistic concept now? Is it necessary to speak now? Because health and diseases are there for a long time. Why do we focus it on now? As Sir said in his chief guest address, there is rising burden of chronic diseases. Chronic disease management itself is a big topic. So if you really go and understand or experience, if anybody at your home has chronic disease, you know what are all the difficulties the individual faces, the family members faces, it is there. So there is some method or techniques required to provide comfort and promote wellness or health promotion of the caregivers. It is essential. Mental health crisis, it was also told in the chief guest address, it is increasing. Even a kindergarten children are having stress. Without even knowing what is stress, many of us say we are stressed. So this is the crisis which is growing very badly. There are limitations of biomedical model, and pandemic, COVID-19 pandemic taught us many things. So post-COVID, there is a need to have some system which addresses all aspects of human life, and patient expectations are changing. Not like previous or olden days patients. All are coming with diagnosis test to be performed, what prescription we are supposed to give, what treatment they expect. This is how the patients are, their expectations are changing. So patient comes with stomach pain, if the doctor is not advised ultrasound, they are not happy. They themselves will say, sir, we want this investigation, that investigation, like this. So all are doctors now. The real doctors have definitely a very tough task to manage these Google and WhatsApp doctors. Escalating healthcare cost. So with integration, we can very well limit the length of stay in the hospital and other treatment costs too. Workforce burnout and moral distress. Evidence for body, mind and lifestyle interventions are available. Equity and social determinants of health. Global policy momentum. Digital health enablement. Alignment with nursing philosophy, because I said nursing is always teaching holistic. Nursing students, you know very well, we are treating the individual only, we are not treating the disease. The patient's diagnosis at the time of admission till the discharge is the same, whereas nursing diagnosis constantly changes time to time. As the patient progresses, the priority is changes. This is how the nursing process is designed. And when a patient says pain, immediately we will not advise you to give a pill to solve or to reduce the pain. We have other modalities, give them a position, diversional therapy. This is how our nursing process is designed. So if you really wanted to practice nursing as per the philosophy, we need to understand the holistic health concept. Shift towards value-based care. Planetary and environmental health concerns, because climate change is a major issue which we are all facing its effects. It had gone very badly, but without even understanding, we are working on it. So we will have to work a lot on it. So for that also you need to understand the holistic concept. And future ready healthcare systems. It is changing. Healthcare is dynamic. It is simply changing a lot. So future will be definitely integrative holistic health concepts only. This is an AI generated picture. I just asked what holistic health is. It generated this. This is what is. It integrates all aspects of a human life. So how it is evolved? Another interesting story in the evolution of holistic health. It started, there is some traditional roots. When the human beings were born in the very first, from the very first man born in the world, from that time, health, concepts of illness, diseases, everything was there. They might have had some measures to treat and manage illnesses. So this is how the medicine started. There are indigenous healing systems like Ayurveda, Chinese medicine, yoga, mindfulness, community-based and culturally embedded practices they are. After that, the biomedical dominance have come, then the contemporary integration is coming now. So the evolution reflects shift from treating illness to optimizing health. You see the origins are from ancient indigenous healing system. If you take in India Ayurveda, it is more than 3,000 years old. It says health as swasthya, that is defined balance of doshas. We have experts who will be teaching in detail about what these doshas and what actually this Ayurveda does. Traditional Chinese medicine also is the similar way. And indigenous tribal medicines, Greek medicines, they are all traditional indigenous system of medicines. So health is viewed as a harmony and balance, not merely absence of diseases. So all these traditional medicines, the philosophy is this. Then the spiritual or philosophical era, after some time it was believed that there was a relationship identified between religious practices, spirituality and health. So this was also gained some importance at these period, pre-17th centuries. Then came the biomedical model, 17th to 19th century, golden period of medicine, lots of inventions have come, lots of treatment modalities have come. So we could address and treat many complicated diseases. The survival rate increased, the life expectancy increased. So like this, lots of number of advancements happened during this 17th and 19th centuries. The impact is dramatic reduction in mortality from infections, however, fragmentation of care and neglect of psychosocial aspects when the biomedical model is considered. Then the reaction and re-emergence of holism. So it's like Ulakam Murandai. How we started, we are going back to the same systems with advanced knowledge and technology. So psychosomatic medicine in 1930s and 50s. So with all these things, all these things that aligns with WHO's definition on health. That is a very well-known definition. This marked a turning point toward holistic thinking and public health. So then humanistic psychology. So the psychological concepts have evolved. As you all know, nursing students may be knowing the Maslow's hierarchy of needs and Martha Roger's nursing theory. So these things emphasizes the psychological factors on wellness and health. So the holistic health movement, 1970s and 90s. Race of lifestyle diseases, stress and dissatisfaction with purely biomedical care. So that is where it is not that originated. Already something was there which was not identified or known by many people, now started emerging. Yoga, meditation, mindfulness, nutrition and lifestyle modifications, alternative and complementary therapies have gained its importance. The emphasis is self-care, empowerment and prevention. So not nursing contributions in these aspects are, the nursing theories, Jean Watson, Martha Roger's, Nightingale's environment theory. So she said, put a patient in a safe and comfortable environment, it improves healing and progress. And Jean Watson's and Martha Roger's theory also focuses on psychosocial, the helicity, energy system around. The concept are understanding between the body-mind holism. So this is what these theories says. This also we adapt in our nursing process. So nursing adapted the art and science of healing. So this is what we are practicing, but since we are practicing in a biomedical model, these things are given some least importance. This is how it has come. So now we are happy, we have n number of nursing researchers, all PhD researchers are having a holistic ideas of. Many of the nurses are coming up with bundle of nursing interventions which addresses patients' physical, biological, psychological, social. There are n number of studies on quality of life, stress, self-care, stress. So nurses are coming up with more researches on this. The body-mind medicine and scientific validation. So this emerges as psycho-neuroimmunology. There are researchers demonstrate the links between stress and immune function, emotion and cardiovascular disease, mindfulness of pain, anxiety and depression. So body-mind medicines gain legitimacy in academic and clinical settings. Now it is integrative health era. There is a shift from alternative to integrative. Initially we used to call the other therapies as alternative medicines. Now it is not alternative, they are integrative or complementary medicines. They combine evidence-based complementary therapies with conventional medicine. The WHO national policies also recognize this integration. So because this focuses on safety, regulation, evidence and patient-centered outcomes. So the healthcare systems adopt integrative clinics, lifestyle medicines and whole health models. We see lots of wellness centers now. People are gaining their idea on what actually the concept says. The 6 pillars of lifestyle medicine is whole food, that is plant dominant, physical activity, restorative sleep, stress management, avoidance of risky substances, positive social connections. If you take a survey, there are many questionnaires available. You yourself can evaluate yourself and see what balanced lifestyle you are practicing. Now, you may not have the effect now. Whatever we practice now, it has its impact on the later days of life. This is why we keep on saying to the younger generation, focus on this, focus on this, focus. I know there are many malnourished children. They don't take, they are not having that capacity to take care of themselves. They themselves are weak. So this is, you really have to concentrate on these areas. Then comes the evidence. Some of the evidences I have put, these are some of the research studies which has done on body-mind researchers. All these evidences says that there is scientific legitimacy. It is scientifically proved there are research evidences that there is body-mind connection. It is reversible. Your stress acts on the body, physical body acts on your psychological components. And it has a clinical relevance, that has system relevance, professional relevance to nursing too. So there is always evidence, but whatever evidence we have is not sufficient. We need to build more evidences with the help of research. The evidence base, what research reveals is there are social determinants of health outcomes also. There are n number of researchers. Socio-economic status, education, neighborhood environment, social support networks also influences health and disease. So scientific evidences which are supporting holistic health includes always it has positive physical health outcomes. It helps in mental and emotional health, social and community health, and cost effective and sustainability. So there are evidences, but some more evidences are to be built on this. What are the challenges? Anyhow, if we do, there are lots of challenges. So despite of growing evidences, challenges remain. Variability in quality of evidence for some, because there are many therapies, how will we integrate it? That is a challenge. Risk of misinformation and unregulated interventions. This is what actually we are facing now. There are lots of, one day you see, you take water, warm water with jeera, it is helpful for weight loss. Some YouTube channel will say you should add this with this, you should not eat this, you have to take this. There are misguiding informations available in the social media. So where will the individual go and seek for it? What is genuine? How will people get a genuine, reliable, validated information? So this is really a challenge in the digital era now. A need for standardized guidelines and there are many powders are coming, syrups are coming. This is herbal, they say. And most of the people are cheated with the herbal products on cosmetics now, younger generations. So these are all some of the challenges which need to be regulated, and balancing cultural respect with scientific rigor. So then, what is the ethical responsibility? We have a separate session on ethical guidelines or ethics of integrating this complementary medicine with modern medicine. So evidence-based informed decision making are required. Patient safety and autonomy also is a question. Interprofessional collaborations. There are some ethical challenges too. What will be the future? So holistic health becomes mainstream medicine. So some of the imaginary things I have put here. It may be the future is holistic. Prescriptions will include practices, not just pills. All our prescriptions are having tablet, syrup, injections. It may have what exercise you do, what is the duration, what diet this may have. The prescriptions may come with that. And mental health is equal to core health indicator. Your mental health will determine your physical health. And personalized holistic care via AI. So everyone may have an app that will tell you get up now, eat this, don't eat this, walk this much. Now itself there are wearable devices have come, but it may go to a next level. Nurses as holistic health leaders. We may have our own clinics. We may do holistic health nursing practice too. Technology meets tradition. So always this integration is needed. We should not forget the roots. That is what the evolution says. Where we started, we are going back to the same thing. And prevention over cure becomes the policy. Prevention is always better than cure. Spiritual well-being gains clinical respect. Spirituality, nowadays people think spirituality is only for elders. It is not like that. That is also a component, all must address it. Trauma-informed holistic care. So when you talk about disasters and all these, this trauma-informed care is also very, very important. Then treating the physical components and symptoms. The people at stress and this victims of violence need the psychological support and counseling. So that will also become a very good practice. And community-centered healings. Education reforms in health sciences. If we have to practice holistic health, we have to learn it. That must be integrated in the medical and nursing and other healthcare professionals curriculum. We must be trained for it, because now nurses, if they want to do a experiment or research on the complementary therapies, we are undergoing a special course and getting trainer certificate. After that only we are eligible to do it. So now I am doing one study on cognitive behavioral therapy and diabetes to promote self-care. So I am not a CBT therapist. I am undergoing the course, 7th is my exam. So after taking that exam certificate only I can do this. So this is how we are building the evidences. But if these are all integrated in the curriculum and if you are trained, no need for extra certifications, you can practice on your own. And the outcome measures are expanding, like quality of life and other components are added into the healthcare outcomes. So this is also a AI generated image. I just asked how the future will be holistic health in 2035. This is the topic what we gave for the poster presentation also. So it will be like this. It will be good. It is going to be beneficial if we really understand and if the practices are guided under the regulatory guidelines, and if eligible trained professionals practice, this is definitely going to help the humankind. This is my imagination. I gave my description or inputs on ChatGPT. Imagine a machine. You just go into a machine. No need of any invasive procedures required. With the help of AI, this will assess you completely. Physical, mental, social, psychosocial, everything it will assess, and it will give you a holistic prescription. It may come. See, when AI initially started with, I was telling, maybe after some time, we may not require CT, MRI, ultrasound, separate. All will be in one machine. You go inside, come out with some prescription. So this prescription will be a holistic prescription. May happen. Imagination, there is no cost, no rent. We can imagine anything. With this only many research ideas and inventions are coming. So we are expecting a day when only that recently we were talking about. After 10 years, will there be classrooms? We do not know. What will happen to the education system? You can sit everything and do. When you want to integrate everything, so this mobile, which has everything, after some time there may be one machine which may come to guide us, lead us, whatever way we want, we can fine tune ourselves. May happen, who knows? So we have to wait and see how the future is going to be. So holistic health reminds us that true healing occurs when the body is treated, mind is understood, and the spirit is nurtured, and the person is respected as a whole. So this is again AI generated conclusion. It gave a conclusion like this, so beautiful to see. So I just wanted to, this is my last slide. To improve or integrate holistic health, it is a human-centered care, outcome-driven evidence, longitudinal perspective, integrative practice is required, systems thinking is needed, transformative role of nursing is there, innovative and digital enablement is required, compassion with accountability is the key. So remember this mnemonic holistic to practice holistic health. So holistic health reflects our journey from wisdom to evidence and our future from treatment to transformation. So these are my references. Thank you very much.
Thank you, ma'am, for the fruitful information. May I request our Vice Principal, ma'am, Professor Meera Saravanan, to bestow a memento to our Principal, Dr. Jayadeepa. Thank you, norms.
The future of medicine is one not just prescribed, where sensors become sentinels and data becomes the bridge between patient and the provider. We are privileged to have with us Dr. Gopi Chandran. Dr. Gopi Chandran is a distinguished nursing academician and clinical consultant with over 2 decades of excellence in medical surgical nursing, specializing in neuro nursing, cardiac care, and traumatic nursing. Currently serving as Assistant Professor and Quality Manager at the prestigious National Institute of Mental Health and Neurosciences, Bengaluru, he brings extensive international and national experience, having previously served as Associate Professor at AIIMS New Delhi and Head of Department at Al Taif University, Saudi Arabia. A pioneering figure in nurse-led care models in India, Dr. Gopi Chandran has revolutionized patient management through innovative approaches, including the development of DATCAN 2, a mobile application for heart failure management created in collaboration with AIIMS and IIT. President of Society of Cardiac Nurses, a former president of TNAI Delhi, he has been instrumental in advancing nursing practice standards across the country. His expertise as pan-India faculty for BLS, ACLS and CCLS, he has trained many nurses in life-saving interventions. His pioneering work in integrating artificial intelligence and telenursing into neuropsychiatric care, coupled with over 173 national and 11 international presentations, establishes him as a leading voice in advancing evidence-based nursing practices and digital health innovations in India. Sir, we invite you. I now invite our principal, Dr. Jaideepa R. to welcome sir. Thank you, ma'am. Thank you, sir.
Thank you very much, madam, for your introductions. Warm welcome. I think this stage is well set for me from the talk from our chief guest. He has well highlighted about the need of the hour. You know, it's not like only health. It's every citizen of, I can say globally, to realize that where we are standing. I think COVID taught us a lot to made. I think today everyone in the whole ground with the people running and walking. It's only in the metro city now, in the village it's happening, because to understand, realize that the self-care is very important to understand. It's not only that we talk about genomic, all the thing, it's, later predictive. We are health professional realized what is the transformation happening. But but today we understand, I'm myself, I changed a lot, and, and I have seen others also. But still, when we see that the student from abroad, and they keep looking at what India is different, how the healthcare system happening here, and what we are something is leading, or I can say what happening in. It's not only in in medicine, in nursing, and everywhere what they are doing. This is really great learning globally what we are doing. Even I travel to other country where we learn something, where we can able to integrate. Overall, we understand we are human being. We love, we understand, we do something better for ourselves, better for others. We do good only, we can do others something. That's what is very important to understand. And we have huge role as a healthcare professional. We learn continuously being a professionals and keep doing, innovate ourselves, do something, make the differences in the outcome, what we are trying to do. We, all the time, outcomes are very, what madam is made already, one more said for me to make it very clear what is my concept today. I'm going to talk for another 30 minutes, very crucial, because it's a huge area, it's happening in India. Within 30 minutes, I'll quickly, some of the slide I'll pass, but don't mind it, but definitely the message will be there for you. So we understand that India, especially healthcare landscape, India has huge difference. Why? Because I told you, I was in AIIMS Delhi. I was, I was initiated nurse-led, the clinic where in heart failure, that I understood patient come from long way to reach the hospitals. We do treat they are very, very poorest to poor. We get some what they are reaching, and finally when they go back, they are not able to follow the treatment because they are not understanding exactly the disease, the complexity of the disease, and complexity of the treatment. As being a professional, the complexity in terms of diagnosis is different, but for them to understand what is the medicine, 5-10 medicine, what is the importance. So that way the complexity for them means they are different level. India, we have that. We know poorest, I told you, richest people also in India, same like, another way I can say educated, illiterated, even they are not, still India, I'm not telling, maybe we are improving better. In this type of challenges for India, how healthcare, very accessible, affordable, because we talk about physical, mental, social, aspectal, but we are India very concerned about cost effective and accessible to everyone and continuous care, because patient, we have many aims started, patient reaching to the hospitals, or the treatment after treatment, are they able to follow a treatment? Because we have seen so many patients readmitted because of the adherence. The treatment adherence means they are not continuing the medicines because they are not able to buy the medicines, or they are not importance or understanding the medicine, which important is most important they have to take. I can say many examples, but because of time limit. So, but we understand heart failure patient, there is a different medicine which they are supposed to take, instead of they take only the medicine which is very, very cheap medicine, they take it. They are not understanding the importance of diuretic, importance of, beta blockers, they are supposed to take it. So that way, we understand that keep most important, we are not only for patient, ourselves also, the discipline is a concern, because the sustainable behavioral change is most important. Today, I want to change myself, but tomorrow I may continue same. That was happening in every citizen and happening in patient perspective more important, because already suffering. So they are changing in terms of their behavior, like they're stopping their alcoholism, stopping the smoking, changing the diet pattern and taking the medicine. That's what the most important, the health promotion, preventing the diseases, that what sir was talking about. That is a huge challenge than treating the patients in the bedside. They have become relieve the symptom. That way, the digital, it's an innovation, digital integration is much, much helping today in India. Accessible healthcare, and again, the continuous care where we can able to do, and that, that whichever that, it's irrespective of whatever, the patient come from Bihar, come to Delhi, treat, again, we are able today monitor them by remote monitoring. These are all happening because of digital innovation, AI powered and data driven, the way they do precision medicine. These are all happening today in India. That's what I want to give the message to the international students who come. So even myself involved so many area as nurse driven, I can say nurse led, for personalized education for different diseases, patients who are suffering with different diseases. So other than that, also we have so many working right now on predictive modeling, so many area when I'm right now in MANS. So this way I want to be very comprehensive presentations, how that we can say that the word is called digital therapeutic. Digital means, we know that the therapeutic means a treatment. With the help of the integration of the digital, how we can treat, manage, very important, prevent these diseases. That's a very, very important concept today. That's what I just want to highlight you another 25 minutes on this. So how that wearable, devices that today we are doing, I am wearing today, this I know myself what is happening to me. The feedback system is most important. That's why we always see that perspective, we see the mirror how you are every day. Same like your activity, what you are doing, your weight, your physiological, all kind of, our parameters. This make you every day that how you are doing. This is the very, very important today to know. It's a reinforce yourself what you are doing great. It's kind of motivation, self-motivation for you. And biosensor, I think during COVID we understood that everyone talk about the saturation. This is the biggest, everyone know that pulse oximeter. So very, very happy to say about this. Two made very much sensitize everybody. That is called pulse oximeter. Another one, everyone talk about protocol. Even medical people doesn't know about protocol, doesn't know about this, because ICMR protocol. We made very happy that today the evidence-based, medicines are emerging, and protocols are coming very sharply, and people are talking about what is your standard treatment. So that way there is a lot of transformations. So the biosensor is very huge role today, especially for, for risk predictions and, yearly detection of the diseases, especially glucose level, your saturation level, and ECG parameter. This all really make the differences. Yearly diagnosis, yearly. That thing everyone know about stroke, heart cardiac diseases, biggest NCD we talk about. These are very crucial for emergency treatment. The time is a huge factor today, especially India. Reaching to the hospital itself is huge, but early intervention, early management is make the difference in the mortality and morbidity. I think everyone know that. It's a country like India, we have very limited access. Still, we are more better. We are improving a lot because of so many changes happening, because of the investment in the healthcare is huge today in the government of India. But still, the landscape is different. So many hills places, so many places, it's very reaching to the people itself difficult because demographic, landscape in India is so much different, diverse in any other places. That way, we need like a remote monitoring through the biosensor and wearable disease. Lot of make the difference in the patient can be immediately transfer them where the patient required, when it is required. That differences. That's why the digital therapeutic is make the differences. How the integrating these wearable devices and biosensor remote monitoring. That it's an effective combination today. You can see today IIT Chennai is a leading in terms of more innovative product in this all this aspect. And IIT Mumbai, and even we are in IAS, Indian Institute of Science, we are today is, be collaborating and make the difference because they are only deliver the product. We are the provider of concept in nursing perspective or health promotion perspective or treatment perspectives, doctor or nurses. Even tomorrow, the traditional medicine also going to be, integrated such a manner to talk about all Verma, all the thing will be happen tomorrow. Globally, they are going to be visualized that what is happening today. This is what digital is one of the great aspect is. You can globally can come to know that everyone what is happening or the value of our, that, whatever we are doing, great things can be visualized or can be sensitized the people who really looking into that's very important. So that way the digital is today era, AI era, what madam was talking about, all the aspect will give you that the treatment or prescriptions. That way when you want to know your, your what is happening inside, you need some connection. That connection is your wearable devices and biosensors, all this, whatever the AI tools which helping to know what you want to take, that is finally give you data. These all give you only data. The data will give that knowledge or the perspective, what you are looking into that give the predictive, whatever the model we are looking into that, or diagnostic model which you're looking into that, or treatment what you're looking into that will be concluded. The core concept, whatever I was talking about it, this is wearable device, biosensor, and remote monitoring. This all will together today. Earlier we used for separately for that, for our health promotion aspect, we use for wearable device. Biosensor for just for to know that any of the patients who discharge want to know to continuously know that data just one. But today, all together, we can continuously monitor. Wherever the patients are there, we can able to monitor. It is in the cloud store. It's also linked with the data where you can take the diagnostic and also for treatment perspectives. So we already explained about it today. Everyone is using the wearable devices, and I think most of the people, I have seen AIMS faculty, everyone wear today that digital, watches. They themselves, how many hours they are standing per day, how many hours they are standing, how many energy they are producing. Even I'm talking about doctors, means they themselves are too much today after especially the COVID, because we lost so many health professionals. They were suffering with the, who are already have that non-communicable disease, who are so much prone to get into the COVID. They are not able to sustain it. They are not able to recover from the disease. So biosensor is another most effective, which is the molecular level detection of the anomalies, especially biomarker was. It's very, very important. The precision medicines, especially for diagnostic accuracy, depending upon the biomolecular level. That's why, you go into they will see that biochemical result, they see the radiological result, they go everything, then finally take, even for cancer also or for any treatment, they take the final accuracy of the diagnosis depending upon all level of the, your result or report. That way we need that today that emerging technology biosensor is implantable, very non-invasive also, help them to, facilitate to get the data at, molecular level. And precision with the biosensor, already I was talking about that, because so much, today complexity in terms of the diagnosis, either cancer, even heart failure, or even COVID itself, we have a lot of, the clarity was missing for diagnose the patients who are non-symptomatic, symptomatic. So much, we were doctor confused whether the patient at which level, whether the patient able to respond to the treatment or not, outcome is there or not, whether they develop complexity in terms of that, again, complication will be there or not. Again, adverse events of the drugs also is a huge today, it's a very diverse, because one patient may accept the drugs, another patient may not be. Even same patient, the first time, even penicillin happened, one of the patient, first time there is no allergic, next time it was allergic. That's what we talk about. Patient itself is a different experience by the doctors when you're treating the patients. So that way we must be very much precision is required in terms of that treatment. That's why the biosensors are helping them to, to treat and, but accurately can diagnose and treat it. So same like I think smartphone. When I started the work first in 2016, my ethical committee is not approved in AIIMS Delhi. They told, I'm not sure that everyone use the mobile phone. The patient come from different background. They may not knowing literate. They may not adapted. And how you develop the mobile application, even they were not funding. Then I was convinced them. I told I will go and take the survey. How many patients they are having the mobile applications? How many patients they are able to do either family? Then after survey report show that is more than 60-70%. Then now if we see the same survey we do at NIMANS, is more than 95% people who are using the mobile application. They are using smartphone and they are using the Wi-Fi. I mean that they have that network facilities. We are not having any negotiation today. India is empowered in such a manner, in technological perspective, everybody use the mobile, especially, we are using that Google Pay, so many, payment system model. It helped to know everybody to use it. That one of the great advantage for healthcare professional, utilizing that opportunity, the literate level of the people on the mobile phone, and that, in terms of the using the mobile phone, using the digital technology, helping them again, back to them again, how they can use it for them for the reinforcement or education perspective, especially personalized education, what they required. So that and all, it's really helped them improve and also manage the disease. And remote monitoring, I already discussed about it. We have very good in the system. I told you, healthcare system, earlier we talked about health, the equipment, we talk about health professionals, doctor, nurse. Today, the digital structure, especially we talk about EHR, electronic health record. I think everyone know about today, Aadhaar card, then ABHA number. ABHA number means the number which is the unique number for you for healthcare record number. From Ayushman Bharat, it's in Government of India, initiated that to give the free treatment for everybody, that especially for who are, less than in their economically background, and they can eligible to get into that. So you have that such a facility integrated by such a manner in ABHA because of the digital management. And eSanjeevani, I think everyone know about it. It's a digital platform created by Government of India where you can do that all kind of, telehealth and telemanagement. In such a manner, all are cloud management. The cloud management data is stored anywhere you go with this number, you no need to carry your ECG record, you no need to carry your X-ray. Everything can be transferred from one hospital, from AIIMS Delhi to NIMANS. Doctor can open your data. You doesn't require to carry your CT or MRI to that doctor if you have same problem, you're suffering with the brain tumor or whatever it is. So such a manner today, the technology helping to reduce the burden of the patient, reduce the burden of the family, and continuous tracking of data, and reducing your hospital visit. I was at the treating the heart failure patient, and they usually come by 1 month after. During COVID, they are not able to come. During COVID, because that everything stopped. Everything was, we are not able to come out from home. But I am telling you that time, there is no patient was died. Even they are suffering with COVID. This is because we continuously monitor their heart rate, their weight. They were keep telling them about diuretic, for their adherence, and titrated the dose also through that by therapeutic manner. You see, this is what we did it at the time of COVID, even for cancer patient, that make the differences. Being a nurse, we are doing, out of the, what I can say, boundary. We are only compassion, all things. We being a translation research, we've taken initiative and trying to implement. You see the outcome, what I talk about, whatever mortality, morbidities, quality of life, readmission rate. These all really make the differences because of the integration of this technology. So telehealth, I think everybody know about it. Today, telemedicine is initiated such a manner. And also we have, very automated alert system that I'll show you my project, whichever we did it. The patient get alarm every time, what the time they're supposed to take medicines. Even it give alarm for them also, tomorrow, your date of your appointment, date of your, you're supposed to visit your doctors. These type of things are really reinforced, because I know that the breadwinner of the family suffering with one disease, chronic disease. Every day he has to do job and get the money for the family, for their life, for their day. Always negotiate, especially you know that men always negotiate that I don't want to take the treatment because whatever I am leave, I will do something for family. And again, women also, same other perspective. My children will suffer, I will cook every day, I will do all the activity. I maybe negotiate with their health because of the demand of the family. These and all we have to be considered in India because compared with other country have the different support, financial support by their policies, national policies. But India still need to come up in such a manner. But this type of nurse driven, or I can say this digital driven, the type of healthcare, help them to reinforce them, make them to sensitize them, make them to, to alert them that your health is priority, or to go, to make it that way. That improve different outcome what we looking into that. So I think this is one of the huge area because I thought initially 50 minutes my talk, now 30 minutes, just why I'm just, but sensitize you very well about it because tele-nursing, telehealth is the overall broad perspective. But education, telemedicines, these all tele-nursing today we talk about. These all like today integrated such a manner with remote monitoring and all I talk about digital, therapeutic aspect where we are able to continuously, teaching them, continuously monitor them. And again, the patient not able to reach, especially like in small village, the patient suffering with any of the congenital anomalies, they're really looking for treatment. They are not even diagnosed. They go to primary health center. From there, they connect with the cardiologist in the higher level center. The primary healthcare physician can tell that these are the patient problem. They can video conferencing. They can able to guide them where they can able to even admit where they can do surgery. This is what system today happening in India. The health system, tele system is helping them to integrate the district level hospital to the higher specialty hospital to the primary health center, accessible to everybody where they can able to treat, which is not level of the treatment, where they require this reference that initially start with by video teleconferencing method where they have to confirm it this patient is suffering with the diagnosis. Before that, they will tell them to do many report is required like ECG, whatever they required, they can be ready. That help them to, they facilitate, they can refer to any of the JIPMER or wherever or their capacity, or they are not treated by this hospital, they are required to any corporate where they can, government is afford and do that. The insurance based system also is enabled in that way, the digital. If you go to Ayushman Bharat, the digital, your financial reimbursement also integrated. Please, that be very important to understand. Even many of the people today not able to understand Ayushman Bharat. That way they can able to do. They are making the big plaza that 10 minutes more. So store and real-time monitoring is a very, very important. That's a huge impact. It helps them with a chronically suffering patient and also remote monitoring, mobile health. I think this is what I talked about this, how we started between the patient. We nowadays talk about sharing the data, initially video conferencing. Then we talk about patient, real-time monitoring is happening because of remote monitoring system and primary care practitioner helping with all data, whatever I talked about, storing of their data in the X-ray, ECG, CT, MRI, and they connect with the higher center for the treatment. I think COVID was taught us very well, and even it was well understood everyone. The chronic disease, the acute disease, you treat the symptom and patient go back to the hospital, go to the home, they will be good to do that. Their quality of life is different. But chronic disease, either cancer, patients with different stages of renal diseases, different stages of heart diseases, different stages of liver diseases, I'm telling you, these are really make the difference in the outcome by not only treat the symptom, they continue their, monitor them, keep reinforce them, and again that continue in the treatment also very different, phases is different. So that way you need really to monitor, to connect with them and follow up them, and again to motivate them and sustain that behavior is very, very concerned. That's why the teleconsultation, I think everyone know about teleradiology. It's a huge today, the trend today. The radiologist doesn't require, earlier it's go to CT, somebody to show and give the interpretation. Now it's all go to, this all maybe in the advanced country, it maybe exists 10 years before, 15 years before. Now in India, these systems are happening, remote monitoring system, and we talk about tele-home care. I already discussed about it. By nurse-led tele-home care, it's a huge trend today, and make them to be, for especially this helping them to emergency alert. Anything happened to the patients, even COVID, we talk about saturations dropping, we immediately push them to the hospitals. Same like a heart failure patient is the, most important is the heart rate, and the BP is the huge parameters. That because everyone, there is a different parameters. The cardiac parameter, which they who are suffering with the cardiac diseases, pulmonary parameter, which suffering with the pulmonary diseases. These and all need to be monitored, need to be reported. And again, personalized education. We cannot, earlier we teach, I was a student, I teach everything for diabetic patients. But now we teach them this level, which the diabetic patient is, type 2, type 1, what are the risk factors they have? Is there any kind of, that genetically predictive? You have there any factor contributing, environmental factor. So personalized education is the very, very today most important, very concerns that really make the difference, the effective in terms of their outcomes. Not only their knowledge, their follow-up and everything in the health promotion perspective. And I already talked about EHR. EHR is the very good. Today I am NABH assessor. I visit most of the hospital, even in Coimbatore. I visited most of the hospital. I have seen they are well advanced in the EHR, electronic health record. They were, they were all integrated in terms of their treatment, their standardized treatment, the infection control practices, adverse effect, everything they are capturing, and nurses are leading. We talk about quality care today. Quality is very important, is concern, which are also have that identify definitive parameters where they can able to define it and they are able to observe them, their outcome which they are improving. So we also have talked about this payment system. I told you so many things are integrated, is whether Ayushman Bharat or insurance system, everything integrated. I talked about e-Sanjeevani, and this is the very important. You go to the website, so much the information you'll gather, how nationalized system developed today with the national platform for the, for digital platform for helping them. So you think about earlier, I told you 2016, they were negotiated aims like institution, how you can integrate the mobile application in your healthcare. Today, Government of India, e-hospitals set up they are making and helping them to. That's why today this is a trend, how making for transformations, helping to have that improved outcome where it is always challenging. A lot of benefits. I think everyone know about whatever I discussed with you, but overall improve the patient outcome is a huge and patient perspective and also doctor perspective. Doctor also very much comfortable from this. So I think we discussed a lot about it. Artificial intelligence is the is making the differences today. Integration of artificial intelligence that is helping them for diagnosis and treatment, and also I told accessible for treating or helping them benefit of this all, whatever I discussed about it. So for AI-powered applications, machine learning, different aspects. This is another session, we can have it. I have so much I'm doing on this, so we will discuss about telesurgery, telepsychiatric, I think telemanas, I think whoever from psychiatric background from Niman's doing, and sir was talking about every 100 who's suffering with this, then, they're telling 5 minutes. So anyway, so I'm taking very positively, don't mind it. So which make it very much huge that, how that government itself initiating this to, identify the who is suffering with the depressions, especially, the who are failure in this education, who failure in the life, they are getting depressed. These people are yearly, they are recognizing, they have call center, they are able to manage them. And telenursing is one of the very huge perspective and make the differences. I think everyone aware about telenursing. And whole system, what we are doing is a integration with the cloud management, mobile application, patient monitoring. This is a model, I can say that how it will be. You see this today, ICU, that I think it's a very predictive, it's one of the model ICU, I can say, all you can with the tab, they can collect all the data, whatever parameter. Earlier we do documentation by manually, the changing now e-documentations, helping them, you take handover, take a lot of time nowadays, it's make the difference. So chat GPT, same like nurse chatbot. I think most of my nurse PhD scholar doing today, that's in even Niman's, we started on one of the area working on predictive modeling. We are working for chatbot with the patient, whatever they are. This is all really, that's why I told nursing today, the evolving and such in India where we do research, translational research, it's make the differences. It's encouragement for next generation, how make the differences. The huge global market today for, telehealth. I think everyone know about it. That's I think in US data, this much now improved in the telemedicines. They are not going to the hospital nowadays. Through telemedicine, they are taking treatment. That's the biggest market. They're preparing for the software in such a manner. And overall, we can say that safe, equitable, person-centric telemedicines. So these are the area, diabetic, hypertension, mental health support, chronic pain, sleep disorder, COVID, COPD management. These are the area we already integrated a lot of digital integrations. But my work on this, I did it on first one initiated with IIT Roorkee support and developed for the heart failure mobile applications, where really I understood the complexity in terms of the disease and response, elderly people who are suffering. I have the team, I told this is an integrative theme, like within the discipline we integrated where we are doctors, Dr. Sandeep Seth, who treated Dr. Jayalalitha when she was suffering with the disease, I mean, he was hospitalized. So who was with myself, we were really leading this, that we understood this model very clearly. I told you, this is a model, I think everyone, this is the India, we are lacking in the continuity care, transition care. We want to bridge this gap. We understood that's mobile application. We first mobile application developed at AIIMS. We were, Tatkan 2, where we can exchange the information. Patient can share the data, their weight and their systolic, their BP, and especially most concern is their heart rate. These all help the doctor to decide. Where emergency, whenever the patient is, I told during COVID and all, we are mobilize the patient for the treatment immediately. Next is project with almost 20 lakhs from ICMR support. That again, the cancer patient, the pain management, especially adherence of the pain medication is very poor, adjuvant therapy. This is really, I got national award on this area because this is a first unique, app which is triggering the patient for alarm, triggering the, for the adherence, for appointment. With ICMR portal, ICMR support, technically we are able to do this. Lot of, and the patient can report their pain, patient can report their adverse effect of the medicine, chemotherapy. These really made them difference in the, COVID, we didn't lose even one patient. I had 200 patients we were in, recruited. No one patient was died because that much we were able to, continuously monitor. The patient come once a month, they come with simply, they never say anything. We come to know that this all graph will show to the physicians, how was their pain last 1 month, how are their symptoms. This really make the differences. And it's a e-prescription. Doctor can prescribe by the app to the patient even they are at home. See, there's all revolution that happened. It's a very, very safety concern. So many negotiation ethically, we made it. Finally, we were really appreciated by Government of India for this, we got national award for that. The first time for nurse who led this, the project, because it's motivated me a lot to do so many things. That's what I'm acknowledging this. This is the next one, my scholar, I got PhD scholar, which continue with this. I made the AA, same model with the AA integrations. Now their patient have vomiting, trigger automatically what is the vomiting they have to supposed to do. This is a very huge. So with so much data, we are included there. It help them for vomiting, help them for constipation. Its message come personalized education with the AA integration. She awarded PhD from AIIMS Delhi. Then I did it in cancer patient for who prone to get the lymphedema. Then again, this also another one project which is helping them for information, for breast cancers, for exercise, and also they have same thing I told you, develop the discipline, sustain the behavior is a huge task for any of the professionals, because patient will go away, they will forget, they will go away, they will not follow. That way, this also really this one of the project we made the differences. No one got it admitted, developed the lymphedema with who are suffering with the breast cancer. This is a huge difference. This is the one which is currently going on for me, for Niman's patients, where it's a final, another 2 minutes, where we told, I think CVT is cerebrovenous thrombosis stroke patients. We must know about anticoagulation, knowledge, and INR control. This is again ICMR supported. This is what we made it differences. And recently the pilot study proven that definitely sustained behavioral change, better clinical parameter over 6 months. 6 months we follow the patients. It really make the differences. So we understood that integration care model, integrated care model, whatever tomorrow we'll add where traditional medicine also, where the patient looking into the traditional medicine make the differences, because we understood lot of scope for traditional medicine, especially Siddha, Ayurveda, where not treated by that allopathy, not able to manage, not able to give the better outcome, where really you need this, including yoga today is a huge outcome. So transformative patient benefit to health provider, already I was discussing, definitely make the difference in all the outcome which I am mentioning about it. That really huge. But lot of challenges. I told you it's not only funding earlier, but now so many funding, data privacies and regulatory compliance. They will not accept you because your data is open. So you need lot of challenges making this model, but definitely it's very productive if you are using that. Lot of trend is happening. One of the very important is blockchain of data security. It's well like how if you go to SBI, you get password productive. So so many passwords are coming. Same like when you are connecting with the patients, and we really make the difference. New era in healthcare by only digital therapeutic, and I'm concluding that digital therapeutics make a lot of difference. It's provide you personalized and effective patient care and very accessible. This is the message, how madam told the message which she given from her own. I want to tell you that the journey of every professional life, when you become the innovator, entrepreneur, and also policymaker. Nurses is a huge concern today. We are better as a professional teacher, and the real professional, the development is when you become innovator, when you become entrepreneur, when you become policymaker. Still the huge, I'm looking in my generation, I have seen 25 year, 30 year, being a faculty 25 year, being a professional, I can say 30 year, but still I'm looking forward to nurse to become, because we become innovator, and today I'm seeing many entrepreneurs. So I want to use this combined experience, become policy maker of the healthcare in India. That's a huge concern of nurses to become, that's huge concern. I mean, we should, that way professional development exist, not that making many program and we have more numbers. That is not the matter. The matter is when you become policy maker, you decide that policy, because nurses are so much connected with the patients. Your concern, your empathy is definitely make the better, other than with knowledge, make the differences with the integrative manner sir was highlighting. Thank you very much, and my regards, my my wishes from myself from Nimans. Wish you all the best for everyone. Thank you. And say if any question, anything, I think I have no time left for me. Thank you very much.
Thank you, sir, for sharing your information on various digital health monitoring systems. May I request our principal, Dr. Jaydeepa R, to bestow a memento. Sorry.
Good morning, sir. This is one of the very important topic has to be addressed, which you addressed it so well. I have a very small question. Can you just summarize what all the apps you used for cancer patients and for nurse-based also you said something? The first one, I think.
Yeah, that
can you just summarize all
for
the...
heart failure patients.
Yeah.
For cancer.
The first one.
First one. This is for the heart failure, only for that. Second one I developed for the cancer patients, for the palliative care management. Palliative means only for after the cancer they have adherence poor, and adjuvant therapies, adherence is very poor, and we need to follow, because they are in the stage 4, they will think that I am going to die, why I have to take it now. But pain management itself make the difference in their outcome. There will be quality of life, patient family will be happy, they do something, then it's make the pleasure in the family till that's up, because it's always end of the life care will be like this. But every day make the differences there, because we always say the VIP of the family is over their VIP in their family. Same like every patient treated as VIP make the difference. That way, the pain management is a huge concern. We use them for the app, which is we continuously monitor them and how their adherence.
You mentioned Upchar
Upchar app is a AI integrated.
Okay.
How this is a second level of the the app which advanced. This is what for my scholar I developed this app, which she awarded PhD degree. The Upchar app is AI integrated, where it give automatic message. Example, I am entering that my pain level is increased. It will give automatic advice. It's validated information. Validated information. You put input, it will come you when required. It doesn't require something we have to send message. But we validated by different methods. It take a lot of time for validation. That'd be good. This is second one. So rest of the apps are for lymphedema management.
Yes.
We given. Next is for CVT. But so many now I am doing yoga integrated app development. I am another. We have so many development is happening with the different support that IAAC now coming forward. And also I am doing so many other AI integrated false prediction also.
Thank you, sir.
Going on many things, but I leave it.
First, we have a naturopathy head.
Very good.
She's leading
Now
the
now we are doing
department
yoga
and-
started with the traditional medicine, madam. Now I am going with Ayush also. This is one of the consultant from Ayush. I mean from Siddha and that yoga. He is now one of my co-collaborators. We are developing for neurological stroke patient rehabilitation. We are including yoga. We remotely monitor their practices, what they are doing. This is what we are doing.
Thank you, ma'am. I request our principal, ma'am, to bestow a memento to Dr. Gopi Chandran.
Thank you, sir, and thank you, ma'am. I request the invitee speakers and delegates to disperse now for the tea. Tea is being served outside the auditorium, and kindly join us back by 10:10 a.m. Thank you. Participants, please be seated. We are going to begin the session. The future of global health lies in weaving ancient wisdom with digital innovation, honoring traditional healing across continents while harnessing technology to make wellness accessible to all. It's our distinct pleasure to welcome Dr. Anita Saravanan, Assistant Professor at Northern Illinois University and a distinguished scholar in pain management nursing and holistic healthcare. She brings over a decade of clinical and academic expertise, holding a PhD in nursing science from Loyola University, Chicago, along with an MS in adult nurse practitioner studies, and maintains active licensure as both an RN and APRN. Ma'am's research excellence is exemplified through her numerous NIH-funded grants, including pioneering work on engaging older adults with technology for health education and exploring the complex relationships between chronic pain, inflammation, and behavioral symptoms. Her scholarly contributions include over 20 peer-reviewed publications in prestigious journals, with several articles receiving recognition as featured or most cited works in pain management nursing and geriatric nursing. As a national leader in pain management nursing, she serves on the board of directors for the American Society for Pain Management Nursing and chairs the Special Interest Group for United States Association for Study of Pain. Her commitment to advancing nursing education has earned her the Nurse Educator Fellowship Award from the Illinois Board of Higher Education, recognition as Faculty of Distinction at Northern Illinois University, and multiple research and mentorship awards. Ma'am is also a certified mindfulness-based stress reduction teacher, bringing a unique integrative approach to pain management and patient care. Please join me in welcoming Dr. Anita Saravanan. May I request Professor Dr. Nirmala M., Head of the Department of Medical Surgical Nursing, to welcome our resource person. Thank you, ma'am. Without further ado, I request ma'am to take over the session.
Hi everyone, how are you guys? How was the tea? Not nice? Oh, there is some ginger in it, I thought. What is ginger? Is it a herb? Okay, so thank you everyone for being here. In the previous few sessions, we learned about different traditional approaches, holistic approaches to health and wellness. Taking all that into our learning, I'm going to share with you in the next 25 minutes, I hope to stop, on how we can vision a world where the globe can interact digitally. I'm going to pause there. Can you guys vision a world where I am in the United States and I can receive Ayush from here digitally. I would love to have that. I think with AI that is possible and it could be accessible. So the future that you all will live, after I retire, maybe in like 10 years, 15 years, I'm hoping that the talk and all the discussions we have today will bridge the gap between Western and Eastern, Northern and Southern medicines. What do you guys think about it? Let me give you a little background and then I'll start with the slides. The slides are important, but think about it this way. So as of now, if I want to access my healthcare, I have an app called MyChart. In MyChart, I can communicate with my physician in any hospital across the US, okay? So if my app and my physician are able to talk for allopathic medicine, why cannot I, from the US, have access to the Siddha and the naturopathy and the, Ayush, right? All of those from there. Why is it that I am not able to do that? And can we do that? Do you guys think you'll make money out of it? So that's $1 million question right there. So I think AI is opening a new vision and a possibility that India has now to utilize, to use the traditional resources, and of course use ChatGPT to bring our traditional holistic, medicine that's affordable across the world using digital systems. Are you guys going to lead that? You nurses can lead that. Okay, think that in mind, okay? So for now, I'm going to really talk about digital health ecosystems in the United States in 3 areas, okay? Can you tell me the 3 areas? What are the 3 areas? In nursing, what do? You go to school, what is that? Professional education, yes? And what is the other area you do? Practice? Good, thank you for that. What is the other area? Is research important? Is research important? Why? Research is the base for everything. Why are we washing hands now before seeing patients? That is based on research. Why do we say blood pressure normal is so much? That's based on research. Why do we say pulse ox needs to be certain percentage? That's based on research. It's evidence-based, what we are doing in practice. Do you think all these 3 should be holistic and they build off each other? It should, and we hope it will. So what I'm going to do is today touch on these 3 areas, okay? Before that, I do want to share about me. நான் நல்லா தமிழ் பேசுவேன். சென்னையில தான் பிறந்து வளர்ந்தேன். எத்ராஜ் காலேஜ்ல படிச்சேன். So I went to the US in 2002. So I went to school there, got my license, and now I have a PhD. But 17 years of experience as in different types of nursing, cardiac, emergency, post-op. I worked as a nurse practitioner, but now mostly I'm a researcher. So I'm a nurse scientist, okay? I work as an assistant professor. I have a lot of mentoring jobs with students and research, and we are like full-fledged research and practice and education, okay? Let me put you that way. A lot of my publications have students in it, so I'm all for you guys, students. So this is me, professionally, and I am a breast cancer survivor myself, stage 3. So, and I have 2 boys, and it's now 15 years now, surviving breast cancer. So I did use all the types of medicine, okay? So as a survivor, this is a second chance to live, so I'm going to do everything to make it good for nursing. All right, so we moved a little bit more about myself professionally. 2002, we moved, to the US, and post-COVID opened this era of global health and nursing. And that is a window for opportunities for all of us. And I think here at PSG, you are going to be already leaders, and I think there is a great opportunity to use with the alumni and the groups that you have here. in my place where I work, it's in Chicago. It's 1 hour from Chicago at NIU. I teach all types of courses. I've taught maybe like 15 courses, and I do teach the PhD program, a PhD in health sciences. If you're interested in coming there, it's not very expensive compared to other universities. So you'll be in my class. So my research focuses on digital technology to improve health outcomes. That's one of my areas of interest. I do have other areas of interest. I don't want to go into everything, but I'm going to stick to the key things. Again, I'll tell you today, I will share you in 3 areas. Okay, what are the 3 areas? Education, practice, and research. I know you guys looking at your phone now, aren't you? When I'm talking, that's why I'm asking you questions. So the goal today is to understand how digital health systems work in the United States, as we use now in the 3 areas. And then what are some challenges and how, I'll show some exemplars when I do this, and what are the potentials for research. Again, I'm going to focus more on research. So thinking about each of these areas, first I'll take every area and then I'll give an exemplar. I'll give some stats and then I'll give an exemplar. Do you guys know what an exemplar is? Have you heard of the term exemplar? It's a classic example if you want to put it that way. Okay? And then I'll share the impact in each area and then what are some challenges and opportunities. So clinical practice. Look at this graph, guys. So if you see here, according to the ONC, the Office of the National Coordinator for Health Information Technology in the US, you see the blue here, tops here, 96% here, and then 90% like here, and then 88% right here. Do you see these tall, blue in the graph? That percentage, that's 96% use EHR. I know you have EHR here in the hospital system, which is great. And if you look at the 90%, electronically we can send and receive patient data. This did not happen 20 years ago, okay? In the past 10 years, we have seen this huge shift. Of course, COVID made another graph. So if you think about it, if I am a patient in clinical practice, I have my chart, which is connected to the EHR in Epic, okay? So let's say you have PSG Hospital. What are the other hospitals here? Okay, any other hospitals? Okay, so if I go to hospital 1, 2, 3, okay, and I get treatment here for neuro, I get treated here for breast cancer, I get treated here for cardiac. All of these are talking to each other. They're all connected. And I can have access to all of my chart through my chart, which is an app. Does this make sense? Okay, so if in my app, when I open my app, I can contact all the 3 hospitals through the Epic system. It's called Epic. Okay, the software, the platform is Epic. So if I go to, hospital A, Dr. A, the patient, the hospital B, the doctor there can see what test I had, what labs I have had. Do you see that? That is the system we have. So what does it do? Of course, it helps access to care. Easier decision making. It did not solve the entire fragmentation yet, but it also help us, with improving population health. So if let's say, we don't want a COVID, let's say microplastics is in the air a lot, and we want to improve the environment. And we see that certain viruses stick to these microplastics in certain areas. If we find a virus in that area, now through this entire connected system, we will all know what to look for. Do you guys see the picture? That's the potential when we use these connected, integrated systems, if you want to call. So again, I think at PSG, there's an opportunity. I did look at the EHR, system right here, which I know in the next few years it's going to take over and have connect to many hospitals, unless it's already there. Do you guys have that? Can you connect to the physicians in different hospitals by yourself through an app? No, right? I don't think I saw one. I've been, I haven't heard that. Okay. That's a potential to grow. So in the United States, of course, they are very, it's comparatively very resourceful country. Epic charting is the one that all nurses use, okay? I'm going to try and see if this runs. Let's see, I did have connection. All right, okay, thank you for that. So you don't need to see the video here, okay? What I want you to do is just look at this chart. So if you look,
chart review.
if you
So
look,
if it's a follow-up
you can stop the audio.
really all
I don't need the audio. I'll just explain it. So if you go and, you can click on each of those tabs and you'll have everything. For example, you have the labs, you have the MRI, the radiology results, you have all the medications. So if you're going to give the medications to the patient, you will have a scanner, like a barcode, like in the grocery store. So you'll take the scanner and you will check all the rights, scan the patient, and then you'll give the medicine to the patient. Okay? And everything is easier to chart here. The alert systems comes in. And I will not, as a patient, have access to all of these, but I can communicate, with everything. Okay? So I'm going to give these slides to Dr. Jaideepa. If you want to share it with the students, they can watch it later. All the slides have all the videos. I don't think I have time to run everything. Okay, so I can go to the slides. Thank you so much for helping me from the back. Stage people are very important. So this is the My Chart. So I'm going to click on the My Chart now, and this is how, from my end, the app looks. All right, let's move forward. So this is more like an education video, but I'm gonna move here. So if this is your doctor, you'll be accessing, texting them, getting appointments, making sure you can chat with the nurse, even billing and everything is on it. It'll work both in your laptop and also in the phone. Okay? So now let's say from here I have a question to my physician, like, oh, this medication, we can stop this video. Thank you. So let's say if I have a question about the medication, I'm traveling right now, I could contact my physician through that. Or if I want to draw a lab after I go there, so that I could do that. So challenges, like everywhere. I think with hopefully cloud-based systems and more legal and privacy, possibilities, like after we have those policies, I think ChatGPT might be able to take the cost. I hope. We don't know. This is me saying that. It's not cited anywhere. So there are digital inequities. Do you guys think that the older adults can use these systems? How many of you have grandparents here? Maybe 70 plus. Do you think they're able to touch the screen and use the smartphone like us? Some of them, yes. Most of them, no. Maybe 50-50. My mom is 80. She's an expert. My dad is 83. He'll touch it like that. And then he'll say, this is not for me. I'm going to throw the phone. I won't do WhatsApp. No. So how do we reach health? If we are so advanced and you have digital inequities, right? If you go, to the rural areas, how can we reach them if they're not able to use this appropriately and cannot? English is another thing, correct? WhatsApp is amazing, but if we don't have these in our language and they cannot use it, if it's not user-friendly, that's a problem. Cybersecurity, hacking is another thing, and workforce burden. Who's going to train all of them? Who's going to teach and make sure everybody has access? We do have a problem in the United States that the older adults cannot use technology. It's not like, it's one problem. It's everywhere, the problem. So the next area, after I talk about practice, what is the area? Are you guys awake? Are you looking at your phones? No? Okay, we're going to talk about education. This is very important for you. So it's well embedded, when I was in school in almost 17 years now, when I went to the US, I was surprised. I told you, right, I went to Etheridge College, we used real blackboard, we would write, and we had paper pen for everything. We had a projector. So even then, the blackboard system was there. This is quite an old, it's called a learning management system. So all universities have this. Without this, it's pretty much, you don't function, okay? So the learning management system, it's one of the most commonly used one is Blackboard. Okay, here are some numbers. So 99% of the institutions use learning management systems. You guys use Moodle, correct? Okay. 90% of educators use digital teaching tools, so it's well advanced. However, the readiness of students is a problem. You see that 69%, again, inequities. So we use something called Blackboard, and I'm going to share with you. Unlike Moodle, it has many more features. Of course, it's expensive, correct? So if I'm going to teach a class, everything that I teach will be online. I don't print anything. I don't, my videos, I record videos ahead. I put it under the Blackboard. I have all the grades, the students have the grades inside it. So for every class I teach, everything is inside one shell. So every semester it's one shell, and then it's very user-friendly, and it's very, if I have time, I'll share my own Blackboard that I'm teaching without sharing the students' grade in the end, okay? All right, let's see if we have time for that. So other platforms that are used are Brightspace is a very common one. It's called D2L. Many universities use that. Canvas is another one. I haven't heard of Schoology, but I just saw that, in a resource paper. Okay, so there is another software called ExamSoft that's used in many schools, particularly law school and medical school. And now in nursing, we use in our place, it's called ExamSoft. So this software can proctor the exam with a lockdown browser. So there won't be any papers to print, there's no writing. It's all multiple choice questions. So we just give the exam to the students, and they look at it, and it grades automatically, and it goes to Blackboard, okay? So I can share that part now. So I'll try to share the ExamSoft video. Maybe we could have the voice for this. So if you see here for faculty, it's very easy. So all the item analysis and everything, it automatically does, and it transports everything to Blackboard directly. So if I'm giving an exam, I will have a Word document with all the questions. I'll upload into this, and then on that time and date, it will be given to the student in my presence, of course. And then after they're all done, I just check everything and I do a click. It does everything. It gives me item analysis, all that I need, and it will also give the grades to the students. So it's very, very, very convenient. Before, we used to have the Scantrons go to the testing center, give it, and they will grade it, and then it's such a big process. This has made it very useful. They did, I think, charge about $100 per student. See, that's always an issue, Again, these slides, all of these videos will be available for you if Madam will share it later. So I can go to the slides. Okay. So the next one is another tool called EHR Tutor. You see, what did I share so far in education? I'll see if you're sleeping. What are the two softwares I shared? ExamSoft, good, one of you said that. One more? Blackboard. So the Blackboard is for actual learning, formative, summative assessments and all, everything is in the course. ExamSoft is a software for exam. We do have another one called, and I'm just picking and giving you one or two. It's called the EHR Tutor. So the EHR Tutor is for clinical documentation. I think this is where PhD can use it. If you can use this, it's again paid one, but if you can create something similar on iCloud, this will be really useful for clinical documentation, I think, for faculty to explore who's interested in technology, something to do. So you can chart your patients, vitals, all their details, and then the clinical faculty will review it and then sign off, okay? So let me tell you, when I teach clinical, what happens. So when I go to a clinical setting and I give a patient, let's say I give a cardiac patient who is post-surgical, okay? And they're in the hospital, and I'm assigning a student to that patient. So this student will have to chart in the EHR tutor for me, and I will go and grade it. What do you think they'll chart? What do you guys chart here? Vitals? Allergies? Pain scores? Anything else? INOs, very good. Anything else? How about medications? And maybe a note, right? A nursing diagnosis. What is your plan for today? So all of this with the critical thinking, you'll chart, and then I'll be the teacher who goes and like looks at it. And only if you do one per patient for every visit to the hospital, you will pass the course. If you do not do documentation, you will not pass the course. That's how it is, okay? So through EHR, we could not only see if you have completed, but also for credentialing in the, for student learning outcomes, program outcomes, we use this data, okay? So I'm going to run that, just show you a feel of that. EHR, okay, here it is. So this is how the EHR looks. So if you go, you can enter everything. You can enter the patient summary if you want to add the disease. Then if you want to add, whatever you want to add, you can add like vital signs. There's a space for labs. You can add the labs. It's a very user-friendly, platform. They do charge for this also, but I think these can be very easily integrated, through the cloud on Google's, Sheets. So this is something I think I would recommend, for use here. All right, so now, some challenges. So we are at the end of education, right? So just like everywhere, gaps in faculty. Do you think all faculty we learned using all of these when we were growing up? No. So it's a learning curve, correct? So some faculty, it's easier for them to learn, more so because we are spread so thin, we have to work so hard to do so many things. There's no time to even learn. So the gaps in faculty readiness is a challenge. It's everywhere. It's there in the US too. When we tried to implement ExamSoft, it was not easy. It takes a lot of time and effort, and many times if it's not used, there's a waste of money, correct? So we want to make sure we are investing carefully. We make mistakes too, we learn from them. We learned that it was a bad choice to give it in the beginning of the semester to have all faculty use it. Guess what, only 3 faculty used it. So we learn. So the infrastructure and funding is again another thing, and we need long-term evidence on how this will impact education. So far there aren't any negative outcomes, so that's good. Using technology for education is not so far showing any negative outcomes. Although there's research to show that using your hand and writing is more helping with retaining and things. So now is the last area. I have 7 minutes. I'll try to finish in like fewer. So research, okay, this is my passion. I love research, and I really love to use digital technologies for research. In the US, there's a huge impact because, I'll tell you why. The EPIC system that I shared with you before is the EHR, correct? That is now accessible for research, okay? You see that? So you see how we are coming a whole circle? So students are using all these platforms in the classroom, and now you use it in practice, so you're already understanding how this evolves. And now for research, you can take all the data that's in the EHR for research. And wearable data also is being integrated, okay? So let me ask you something. If all of you have an EPIC, okay, let's say you have your system, what is it called? Your EHR. What is the EHR called? EMR. You call it EMR. Okay, EMR. So let's say all of you here have your EMR with all your health data. Each of us might have some condition, right? Let's say allergies, whatever, correct? So this, through cloud platform, we could get all the data during your visit to the physician, if you are consenting, IRB consenting, to use that for research. That is using AI cloud, okay? So I'm going to talk about that. So there is this research called All of Us Research. And the goal of this NIH, it's a National Institute of Health database, okay? So the initiative was to collect data from 1 million people. How many people are here, you think, in this crowd? How many of you are here? 400, 500 maybe, correct? So let's say, I'm saying, in this 500 of you, how many of you are interested to share your health records for research purposes? How many of you will share? Can you raise your hand if you will? Okay. I don't see many. So there's lack of trust in research? Okay. So the goal of the NIH was, I got it 5 minutes, was to get 1 million people's data, whoever is willing, and I did sign up my health record for this research. So you sign up and they will have access to your data set. And that data set is used for analysis and to research, okay? So the goal of this research is to make sure everyone is included in research. Do you guys know that women research is way behind? Do you know that the cardiac medicines we take is mostly from men? Do you know that women don't typically have the chest pain that men do? Do you guys know that? What is the symptom for a cardiac for women? Yeah, sometimes it could be abdominal pain, correct? So for that purpose, so that everybody could be equally benefited, anyone underrepresented, low income, different race, different, women including older people. So that was the goal, so we get more data. So as of now, they have 840,000. Okay, so I want you to do this. Use your phone and see if you can access this, please. Can you guys do at that bar at the back? Like, try your QR code, and anyone can access this. Okay, it's a public data browser. Anyone can access this, and you can know. Can you guys open? Is it opening? Okay, good. So you can know anywhere in the world what are the conditions is the highest in the US and what is the percentage of men, women. You see, different diseases. You can put a lab and you can find out. Let's say you want to do hemoglobin. How many people have had their hemoglobin done? Test. That's the thing. But there are different tiers, okay? There's tier 2 and 3. If you want to access more tiers like genomic data, then you need to have, institution approval, and you can do only in the US. You cannot do, from here. Okay, but the public data browser, you can use it. I've had students do posters with that. You can also do it from, but the thing is, why do you want to look at US population? Maybe you want to compare. That's the reason you want to look, correct? So that, otherwise, I don't know how useful that is. But these are all the, content we could take, like surveys, wearable data, we can have genomic data and physical measures in the data set. So this is one poster one of my students did to look at what is available in the All of Us data set and compare with the regular survey questions. This is another poster another student did to look at HDL in MI, so to look at differences in race and ethnicity. So to summarize, digital health landscapes are rapidly evolving, and especially with AI in Epic, you can get a summary of the patient in 2 minutes. You don't have to go and click multiple buttons to know about the patient visit in the past 3 days. If a physician or nurse wants to get a patient summary, they can just say, create a patient summary in this visit, and it'll create a quick one-page report, just like how other AI tools do. So these are some of our research projects. I don't have time to share all of these with you. We have several funded projects. We recently received an AI funding. We got like $100K. So we'll be doing it this year. And here are some pictures of how we work in the community. So these are our students engaging older adults in retirement homes. That's me here. So these are students. This is me, and this is another student. So these are some numbers on how the participants reviewed our smart tablet education project and how they reacted. These are some publications. They should be open access. I have to work on the second open access because they are NIH funded. They are open access. And this article is from the large data set. We looked at 100,000 participants, and we published this for patients who have low back pain. All right, so for everything, things start with good leadership, like Dr. Jayadeepa. You need to have a good, management support, I think, which you do have here. And for us there, it's my dean who really supports what I do. And in fact, they encouraged us to come here with the students, and new programs and initiatives will improve digital health systems. So with that, these are some selected references, and I want to end up with the same thing. I did talk about clinical practice, education, and research, and how the ecosystems work in the United States. And maybe, hopefully, this will give you some idea of how we can holistically look at digital ecosystems as we evolve in the AI phase. So I do want to ask if anyone has any questions. Thank you for listening.
Thank you, ma'am, for the fruitful information. May I request Professor Dr. Nirmala M., Head of the Department of Medical Surgical Nursing, to bestow the memento to Dr. Anita Saravanan.
Thank you, madams. Ancient healing system gain new relevance when traditional wisdom meets scientific scrutiny, validating centuries of practice through the lens of modern evidence. We are glad to have Dr. Raghavendran, distinguished Ayurveda physician with nearly 2 decades of comprehensive experience in clinical practice, medical education and research. Currently serving as consultant and clinical head at AVP Research Foundation and consultant at AVP Training Academy Hospitals, Coimbatore. He brings exceptional expertise in classical Ayurvedic treatments for complex conditions like rheumatology, neurology, gastroenterology, dermatology and pulmonology. With an MD in Ayurveda from Rajiv Gandhi University and PG Diploma in Yoga from Annamalai University, Sir has established himself as a leading voice in integrative Ayurvedic medicine both nationally and internationally. His extensive teaching portfolio includes guest lectures across multiple continents in Argentina, Brazil, Switzerland and Spain. Sir also continues to deliver online classes to students worldwide. Sir's clinical leadership spans prestigious institutions including his 7-year tenure as Chief Medical Officer at Sai Gram Ayurveda Hospital and Research Institute and a decade at Arya Vaidya Sikshalayam and Research Institute. As founder and medical director of RDR Ayurveda Hospital in Tanjore and chief physician of Sri Dhanvantri Ayurveda Clinic, he demonstrates vision alongside clinical excellence. May I request Professor Roslyn Malvuli, HOD, Department of Pediatrics, to welcome Sir. Thank you, ma'am. Sir, I request you to kindly take over the session.
Good morning. Shri Gurubhyo Namaha. I think this, it should not be something new to you, Ayurveda. I think many of you would be aware of the word Ayurveda when we talk about the Indian system of medicine. How many of you are aware? Can I see? How many of you are aware about Ayurveda? Yes? How? Because it is soap. Many people know Ayurveda as a soap, or a shampoo, or a bathing powder, right? Nowadays everything is Ayurveda, no? Before 10 years or 20 years, people may not know what is Ayurveda, but nowadays everything, even the food, people are thinking about organic thing, organic food, because health is evolving, people are getting aware, and lot of awareness about the Indian system of medicine is coming up. So it is our, main challenge in front of us is to how do we take this forward to make this possible to spread globally. This is what we try to take up in AVP Research Foundation. So evidence-based traditional system, basically when we use the word evidence-based, what do we talk? We talk about a lot of research, right? But what Ayurveda we talk is more of a experience-based medicine. Actually, if we tell, since 5,000 years we can say Ayurveda is existing. It's not that they have just written it without an experiment. They would have done lot of experiment before writing it into the text. So, actually whenever we talk about Ayurveda, we tell that the text, whatever is available in Ayurveda is actually evidence-based medicine. It's experience-based medicine. There is a difference between experience-based medicine and experimental. Okay. So evidence-based when we talk, yes, of course, nowadays a lot of RCT, research, clinical trials we talk about, but we will go through and then we will see how the challenges are faced in Ayurveda or Indian system of medicine. Coming to Ayurveda, so many of you are aware about Ayurveda, already one of you have raised. Ayurveda is not just merely a system of medicine, it's a way of living. Okay. We talk about more of a preventive care. Curative care is the secondary aspect. Like whenever we talk about, now ma'am told about how do we take care of the people's health through EMR or different kind of the, all the advanced techniques. We talk about the disease area, but whereas Ayurveda first focuses on the health. We need to talk about the people's health, how to be preventive, how to improve their health through our system of living. So preventive and curative are the two aspects of Ayurveda. We believe in Panchamahabhuta, there are 5 elements. We think that our body is made out of the same 5 elements which is available in the entire universe. So we try to think about correcting it from our earth. Whatever is available in the universe is available in us. So we will be able to balance it both. So we have the concept of Dinacharya, Ritucharya. These and all is actually the basics of Ayurveda, which is not a medical system. We try to talk about correcting their diet, correcting their lifestyle, correcting their, the daily routine or seasonal routine. Even the 3 pillars in Ayurveda, we talk the Traya Upastamba, food, sleep, celibacy. These concepts are not much spoken out because we try to talk, whenever we talk about the health, we only talk about the disease area. We need to think about how do we improve our health without getting a disease. That's what Ayurveda mainly speaks about. So we try to talk about body, mind and soul. This is important area. Globally, it is becoming very popular especially after the scenario of the COVID. Before COVID and after COVID, completely there is a big change. Because even in PSG, we have done a clinical trial with modern medical doctors with Ayurveda comparative RCT studies has been done in the COVID, where we were able to give supportive care for the COVID patients. So now it is becoming very much more popular because many of the patients we manage even in the quarantine, the home basis with the simple Ayurveda medicine, they were able to survive. So this and all is one of the very important thing. What has happened in this year is in May 24, 2025, there is a WHO Global Center for Traditional Medicine. This is established in Jamnagar, Gujarat. This is one of our achievement which has happened. We talk about Ayurveda. There are so many things. Swasthavritta. As I told you, preventive health is the main thing focus in Ayurveda. We try to talk about the base root cause of the disease is spoken. We try to correct the food and lifestyle, and then the medicines are playing the role. Panchakarma is one of the very common, very popular word which is used in Ayurveda, one of the 5 detoxification line of the treatments. Now, why do we go for integrative health? Now this, actually today's your conference is on holistic health. When we talk about holistic health, we talk about, it's not just one disease or one medicine. We are talking about the entire holistic well-being. When we talk about the treatment, it's not just a medicine alone doing a work. Okay, we have to think about the body, correction. So here, bridging the both ancient wisdom and modern healthcare, both is important. Ayurveda tries to bring the holistic approach, whereas the modern medicine is trying to help in the all evidence-based, technology-driven and acute care, surgery. In case of any emergency management, it is really good. Whereas in Ayurveda, we try to go for the holistic health, thinking about the Prakriti, Vikriti, and then correcting as well as the promotive health or supportive care that can be also be given along with the modern medical system. This is what is the next need of the future approach. Why it is needed? What is the purpose? Why we are trying to go for this? Actually, we can increase evidence enhanced patient management. We don't have to just think about giving simple medicine and then thinking of only the virus or bacteria. See, people when they are with a disease, they will have a lot of agony in the mind and they will be with a lot of stress. So just medicine alone may not work. We need to think about their holistic healing, body, mind and soul. As well as there are certain kind of the chronic diseases where they require long term of the treatment without any side effect. Cost effectiveness is one of the major problem because nowadays medical area becomes more costlier. As well as cross-cultural understanding, we need to think about globalizing. When we talk about globalizing, there are so many kind of the traditional practices as well as the modern practices. We need to work together to bring an integrative approach. Where and all we can do. Actually, as I told you, one is preventive aspect is one, which is the primary area of Ayurveda. We try to talk about correcting the diet and nutrition. We try to think about lifestyle modification, the vihara, and the mental health. So this is the area, the primary focus for preventive, whereas curative aspect, there are a lot of areas where we can try to do. Actually, I will try to show you some of our research, whatever we have done. In the lot of chronic diseases, we will be able to give palliative care. In case of like, for example, last month only we have done an integrative oncology, cancer care management through Ayurveda and modern medicine. So there are so many diseases where we can work together, where we can do a palliative or supportive care can be given. And then